Hi there.
Hello.
Hello.
Greetings.
Hi, everyone. I just want to let you know we're going to get started in a few minutes. We're just working out a sign up sheet so we can figure out how to get everyone to sign up. So we're working on a Google Doc for that. We would like to prioritize one. Thank you all for being here. We very much appreciate being here for our final listening session, and we'll keep time open for anyone who wants to testify too on Zoom. But we would like to prioritize to the extent that we can parents and teachers, for the first portion, so the first hour. So if we can, if parents and teachers would like to prioritize, and we'll be hopefully be able to hear from everybody. So just give us a few minutes while we set up that sign up sheet, which will ask you to indicate whether you're, a parent or teacher or with a particular organization. So we'll get started in a few minutes.
No entiendo.
Chara, I just want you to know that you've done an incredible job with these hearings. If you can hear me.
Thank you so much, Senator Kissel. Well, so maybe, sorry, everyone. So thank you for being here. We're going to get started. Maybe we'll just get started and work out the kinks of speaker order as we go. This has been a community event since we've done these listening sessions. So very much appreciate you being here. I'm Senator Sujata Gadkar-Wilcox, representing the 22nd District, which is Bridgeport, Trumbull, and Monroe. We just had our last our third listening session in Bridgeport, and we heard from a number of surrounding towns, and it was really this has really been informative and I think impactful for us to hear all of the all of the concerns and the issues and the narratives and the stories coming from the community directly. So thank you for taking the time to be here. We have a wonderful committee. We're really committed to this work. So as we're, let me just, let's have the committee introduce themselves quickly as we are kind of getting started. And then we do have a few people that were on a priority list that need to speak first. And then by that time, hopefully we will have a plan for how everyone else can speak. We're working on a Google form, but otherwise we'll do some old fashioned calling people one at a time up. So we'll figure that out in a few minutes. But let me just have the committee members introduce themselves, starting with my good co-chair, Representative Khan.
Hello and good afternoon. Thank you all for being here. Thank you. I am Mariam Khan, Representative Mariam Khan. I represent the 5th House District of the lovely town of Windsor, great city of Hartford, and then the town of South Windsor. I am also a special education teacher. I'm happy to co-chair this select committee on special education. And, you know, we have this is our final listening session, and we're wrapping up our listening session tour that we've been doing across the state. We have heard from rural communities and urban community. Hartford allows us, this one specifically allows us to hear from anyone else that we may have missed, because we do have an online option as well. So we'll kind of go back and forth between in-person and online. We're hoping to, you know, hear from every single person that comes before us today. If we do go over time, we may limit, but we do have a virtual option to submit any comments. And so with that, I think, I'm not sure if we mentioned, I think we have, I know we said parents and teachers usually prioritize first, but I do recognize that parents or teachers, at least teachers, are still in school, and parents may be picking up their students. And so we will hear from who's here, and then in the evening, absolutely make that a priority, especially if we have limited time. Okay, I will allow other members to speak, and then we'll get right in.
Hi, good afternoon. My name is State Representative Chris Poulos. I proudly represent Southington, the 81st District. I am a public school teacher. I've been teaching for 25 years. In my tenure of teaching, I've been to many schools across many states and many schools in Connecticut. I've talked to teachers in all kinds of districts, in our cities, in our suburbs, and in our rural districts. And one thing's for sure, every single district has students with special needs. There's not certain districts that have more or less, like per capita, and every single district has its challenges with servicing those students with special needs, whether it's logistical, whether it's providing access or financial. And so my hope on this committee is that we can equitably address the challenges of all districts with our work. And in order for us to do that, we need your testimony. We need to hear your stories, and as specific as you can get, and the impact that the various solutions might have on your districts. So look forward to that conversation. Look forward to hearing from parents, students, districts, teachers, and any other advocate. Thank you.
Maybe we can recognize our ranking member, Senator Kissel, that's on Zoom.
Hi, good afternoon, everyone. Thank you so much for introducing me, Madam Chair. I'm State Senator John Kissel, serving all or part of the towns of Enfield, Somers, Suffield, Windsor, Windsor Locks, East Granby, Granby, and Ellington here in North Central Connecticut. I am particularly interested in hearing from any parents or teachers in the North Central Connecticut area, specifically 7th Senatorial District. Clearly, as Representative Poulos pointed out, this is nothing that is endemic to one particular town or region, that there are students and young people with these needs throughout the state of Connecticut. In particular, though, I'm looking at this through sort of two different lenses, one of which is the omnipresent dollars and cents, right? Folks want more dollars put towards special education needs in their communities, and there's no mystery to that. Although if the speakers could point out, is it being used in a wise manner in their communities? That would be great to know. Is the formula correct? Should boards of education have more latitude as to how they use their funds? So the dollars issue is one whole section of our discussion here, but I'm also looking for low cost or no cost ideas, as well as, do you feel that there's things not being addressed in the system as a whole? For example, our English language learners not being or being put as classified as special education, where it's not really a special education issue, but just having a hard time with English learning and maybe falling behind in certain grades. Does it have to do with maybe lack of paraprofessionals in the classroom, and it just is not a ratio pupil to teacher that that is actually functioning in the way it could. Some of these have money as a component, but some of them are totally how we do things in Connecticut. Maybe we could do them a little more smarter, a little more efficiently. And ultimately, this is all about the kids and how we can best serve children with special needs. So thank you.
Thank you, Senator Kissel. And our ranking member in the House, Representative Corpus, is not here, but she'll be joining us soon on Zoom, so she's not able to give opening remarks. And I don't believe Senator Austin, our vice chair on the Senate, there's a lot of meetings happening today. So for those who are coming later, it's because they're in other meetings. Let's now have introductions from those present first, starting with Representative Zupkis, and then we'll recognize the members online.
Thank you, Madam Chair. Hi, I'm Leslie Zupkis. I represent Prospect, Bethany, part of Cheshire, and part of Waterbury. I'm really excited to be on this select committee. I have worked with people with intellectual and development disabilities for a very long time, and this is a big task. There's a lot of things that are working, a lot of things that aren't. Money is an issue. But as Senator Kissel said, you know, there's going to be some funding for this, but what can we do to fix it? And so why is it so expensive? All of these costs, parents, I know what you go through with your children. I've been there. So it is an honor to be here and to listen to each and every one of you and hope to learn a lot and to hear some solutions. Thank you.
Thank you. Representative Johnson, we'll go ahead.
Thank you so much, Madam Chair. I'm Representative Susan Johnson. I represent the 49th House District. That's the town of Wyndham. And I'm very excited to be here. And I think that the community is doing great work. And it's wonderful to see everybody here to talk about what the issues are and the special needs students that we have in our state to make sure we do the right job.
Representative, if I may, first of all, thank you for that. Completely agree. One of the things.
Yeah, certainly. It's good to hear you too. Okay, thank you, Madam Chair.
Representative Santiago.
Good afternoon. I represent the 84th District in Meriden. I have a child or an adult that's in special ed, has been in special ed, and he's intellectually disabled, and also connected to that is also mental health issues. So I'm happy to be here and be part of this committee. Thank you.
Good afternoon. I'm Mary Wielander. I serve the 114th District, which is Orange, Derby, Woodbridge, and Hamden. Pretty broad swath of different types of schools and educational experiences. I'm also a mom of 3 teenagers. So I am with a history on boards of education and school involvement. So I'm very excited to be on this committee. Thank you.
And then online, I see Representative Belinsky.
Thank you very much, Madam Chair. Representative Mitch Belinsky, I am proud to have to be in my 13th year of service to the families of the 106th District, which is Newtown Sandy Hook. My colleagues have done a wonderful job about talking to the points that we're looking to accomplish with these with these hearings, these meetings. We want to know from you what we can do better, and we certainly know we can. The most important message I want to leave with anybody that is out there to listen is that you're not alone. If you are a parent or a family or a student that is having issues with special education, right now the elementary and secondary education systems in the state of Connecticut, the public education portions, have risen to be over 18% special education programming. So it's an area of renewed focus on behalf of not just this committee, but the entire education committee, and thankfully the governor and all of our leadership. So what you have to say is terribly, terribly, terribly important, but you are not alone. You are one voice. And together you are mighty. Thank you very much.
Thank you, Representative Belinsky. And I see Representative Rader.
Thank you. And thank you for the committee organizing today for this hearing or this input session. I'm just so grateful for all the parents and students and others who are contributing to this. This is how we do good work. I'm State Representative Moira Reid. I represent Guilford and Brantford down on the shoreline. And I also continue to serve on my Board of Education and have watched intimately the trajectory of special education over the last 7+ years. And I'm so grateful we're finally going to try to dig in. We've done well, but we can do so much better. So thank you for the opportunity to listen.
Thank you, Representative Rader. I don't see anyone else on Zoom. Let me just echo what Representative Belinsky said. You know, we're really here to listen, that not only are you not alone, you're heard, because we have really been hearing the stories. And I know a number of people in the community said this is the first time that they've seen a, committee really focusing on special education and hearing the needs of teachers, parents, school districts. So we hear you, we see you, and that's why we want to hear from you. And also just to say thank you to teachers for everything you're doing in the classroom, to paras. My mom is a para, for everything you're doing in the classroom, to parents, and to districts for supporting this work. So I'll turn over my co-chair.
All right, so we did get QR codes out into the audience. If folks did not receive one, we have one at the clerk's desk. So you also can go there. That just leads you to a Google form to allow us to see and call you to just make the process more efficient. And so we'll start calling folks there. And the only other thing I wanted to mention is we have a 3-minute time limit per speaker, just to allow all people to speak. Kira, our wonderful clerk, will give you a 30-second warning by asking you to wrap up your comments. That means that's a 30-second warning, and then she will tell you your time is up when your 3 minutes are up. We're asking for our members not to engage with questions, just to allow more time for us to listen. And that's why in the form that you fill out, your email is collected so that if we have follow-up questions, we can reach out. You've heard from all of us already, so we're not going to talk. The mic is for the public and not for us. And so we'll start going down our list, but if as folks come in, we'll also let them know. And if you want to sign up, you will. So we will start with the Superintendent of Hartford Public Schools, Leslie Torres Rodriguez.
And one other logistical note, I know there's some parents here who actually also are on a time crunch because they have to leave to pick up kids. If that's the case for others, please let Kira know so that we can call you as a priority. If you're trying to manage childcare, thank you for being here and taking the time. So in case there's anybody there that has that issue, please let our clerk know. Kira, who's doing a wonderful job too. Thank you.
Good afternoon. I'm also here with our Assistant Superintendent for Special Education Support. Is that okay? Great. We are. Okay. Good afternoon again, everyone. And good afternoon to the committee co-chairs, Khan and co-chair Gardka Wilcox, honorable legislators and distinguished guests. My name is Dr. Leslie Torres Rodriguez, the Superintendent and CEO of Hartford Public Schools, overseeing 39 schools and more than 16,000 students. And I want to thank you for the opportunity to provide some key information on the state of special education in Hartford. With me today is Dr. Jennifer Hoffman, Hartford's Assistant Superintendent for Special Education and People Services. Ensuring that Hartford students receive appropriate special education services has encompassed some of the most demanding work during the past decade. The work is costly and requires highly qualified staff and resources. And these services are provided in our public schools for some students, but many special education students must be referred out to some other partners, as our district, like so many across Connecticut, is not able to fully staff and equip school facilities in a way that we can meet their learning needs. So I'm here today to advocate for additional state resources to be able to cover excess costs by adding a weight to the state's funding formula for special education. And I want to be clear at the onset that our current overall revenue in Hartford is the same as it was back in 2019, 2020. When adjusted for inflation, this means that the total revenue has actually decreased over time. Meanwhile, right, as we all know, special education costs have increased during the same period of time. And just to give you a little bit overview and some data behind that. We have 3,400 students that receive special education services and supports, and an additional 1,200 that are served via the ecosystem of school choice that we are part of. And special education services require approximately a third of our total revenue in our school system. Special education funding, tuition, for example, outside of the districts, it takes a fifth of our total revenue. As per pupil education, special education tuition has increased by 30%. And so that, since 2019 fiscal year, that's $89 million. Separately, special education transportation is about 1/20th of our budget, $22 million. So when we look at our special education real costs and adjust for inflation, we realize that our per pupil revenue has actually decreased over time, which means that we have
30 seconds left.
fewer dollars to support our students. And so the ask is for the additional weight. And an example of how that would actualize, if the weight was equal to the multilingual learner weight, it would mean $8 million more in revenue for Hartford Public Schools. If it were 2 times, $60 million. If it were 3 times the multilingual weight, $24 million. So again, thank you for listening to us, to the broader community. We too are committed to making sure that we provide all of the services that our students need, and I hope that we can do that collaboratively. Thank you.
Thank you.
Good afternoon, everyone, and good afternoon, Committee Co-Chair Khan and Co-Chair Goddard Wilcox. My name is Dr. Jennifer Hoffman. I'm the Assistant Superintendent for Special Education and Pupil Services for Hartford Public Schools. I began my career working as a special education teacher in Hartford Public Schools, and I have the privilege to provide leadership for Hartford's special education programs with the Superintendent Torres Rodriguez for the past 5 years. First, I'd like to highlight the recommendations made by Dr. Torres Rodriguez to place a weight on the state's funding formula to add revenue that covers excess cost of special education in Hartford and in all public school districts across the state. Ensuring proper funding for special education will allow the district to recover the budget deficit from the increasing special education costs. For example, funding excess costs at 100% will be an additional $5 million to the district, which we can apply special education services and programming to students. Additionally, the current staffing crisis impacts our ability to hire special education staff, which ultimately leads to the district seeking alternative programming and placements. In my experience, special education staff continuously go above and beyond for students. However, they face numerous barriers. To date, Hartford Public Schools faces 47.5 special education vacancies of 217 total positions. There's a wide consensus that special education staff should be incentivized with additional compensation. For example, providing state-funded retention bonuses for certified special education staff, related service staff, and paraeducators. Special education mandates and paperwork exceed federal regulations, which can be reduced without impacting quality of service implementation. Certification requirements for teachers and related service staff, specifically regarding reciprocity across states, should also be reviewed. Lastly, here are a few examples, specific examples of how the governor's $14 million pilot project funding could be utilized. By hiring additional staff to open new in-district specialized programs, districts can reduce or eliminate the exorbitant cost of out-of-district tuition. HPS is currently developing a blueprint to design and implement pilot programs. There is a potential to collaborate with surrounding districts to regionalize special education pilot programs. I thank the committee for listening to all of these comments so we can collaboratively address the state's special education needs together. If there are further questions about Hartford's special education services, please feel free to contact me directly.
Thank you. And any, especially data points that you mentioned, if you'd like to email to us, we can get that to the whole committee. Thank you. I also just wanted to mention, logistically, we do have an interpreter for Spanish. So if you do require interpretation, please let our clerk know. We do have. Oh, okay. And for Portuguese. And so if you do require interpretation, please let our clerk know. The other thing I wanted to mention for folks online, if you'd like to speak, you need to raise your hand on Zoom. So what we'll do, we'll kind of hear from some folks here, then move to Zoom, then kind of switch back and forth. But for anyone online that'd like to speak, they need to raise their hand to be able to do so. Next, we're going to hear from Patricia Sullivan, Assistant Superintendent for Meriden Public Schools.
Thank you for this opportunity to speak to you today. My name is Dr. Patricia Sullivan-Kowalski, and I'm the proud Assistant Superintendent of Student Supports for the Meriden Public Schools. I have been asked to speak today regarding our ability to build a continuum of services for our most neediest students. In setting the stage, it's important to share that Meriden's net current expenditures per pupil has been near the lowest in the state and is currently the lowest in the state this year at $15,296. We do a lot with very little. In 2013, we began our journey in internalizing services that we were outsourcing. By 16-17, we expanded our services within our district, creating high-quality, district-wide specialized programming within our neighborhood schools. We focus on a five-pronged approach: state-of-the-art facilities. We select schools and buildings that can create learning spaces with state-of-the-art equipment, spaces that have the proper learning for the students and their needs. High-quality staff, ensuring we have the right staff for each program is important and critical to the student progress. Strong community partnerships. Having strong partnerships have over the years partnered with the Y, Valentin Karate, Southern Connecticut Autism Center, Kelly Kids, just to name a few. And fiscal responsibility. Each year, the district has saved in our budget by ensuring students' needs are being met within this very large continuum. And finally, and most importantly, educating the whole child. Understanding that students who are educated within their community have a value to all students and all families. Although we've planned an expansive continuum of services, we continue with challenges. It's a challenge in our population as it continues to grow, as other districts decline. The needs of the students continue to rise. In 2015, 39 students were in our specialized program for students with autism and communication disorders. Today, we have approximately 156 students. This school year, we have 24 additional students. While our cost per student in STARS is approximately $30,753, it is double the per net expenditure with limited resources, and these students do not qualify for excess cost. We value our partnerships with our out-of-district schools. We see them as part of the continuum. We cannot do the work without them.
30 seconds left.
The cost of each student has increased significantly. $9 million 3 years ago is at $12.5 million today. So what are we asking for? We're asking for fully funded excess cost, providing incentives to districts to create the continuum, or who have already created the continuum to continue. Create a structure, incentives for these districts to work collaboratively together. A study committee to address and analyze quality of programs.
Time is up.
Thank you.
I will allow Representative Santiago to ask a question. I know this is your beautiful district of Meriden.
Thank you, Madam Chair. Thank you, Dr. Sullivan, for coming in to testify. Are you looking, if we allocate the special education excess costs grant, and we combine that with the municipal school aid, will that special ed still be weighed in as we do the multilingual requirement per student and the poverty level?
I'm not certain if that's the case or not, but I do know that, you know, if we have full excess cost, then we are being able to save an extremely large amount of money, millions really, in order to be able to give and provide for all the services. As with the weight, I'm not exactly certain. But as Hartford was saying too, having that weight and being able to use a weight like that does help us with understanding that each child, depending on their needs, has a different amount that's attached to them.
If I may, Madam Chair, what are you doing to keep the outsourcing in the city of Meriden? So So it saves us money, in other words.
So what we've done is we have internalized services such as our BCBA, our board certified behavioral analysts, our behavior technicians. We have ensured that we have the proper spaces for students and really ensuring that we have the supports that are necessary for the child to be successful in the schools. We are not in every single school, but we are within the neighborhoods of Meriden. And so transportation is a significant cost that is cut significantly. It costs $15 a day to transport a child in district. To transport a child in what we would call a one-off school, so one student goes to a school. So if from Meriden to Hartford is about $40,000 to $45,000 a year. To go further out by Vernon, from Meriden, you would be talking about $60,000 a year. So transportation alone is a significant cost savings in district. Thank
Well,
you.
I want to thank you for being here.
Thank you.
Oh,
A question.
Miss Sullivan, yes, I know we had Representative Zupkis. So while members are going to keep our comments and questions light, we do allow members to ask one question. So she
So
would like to
don't
ask a
run
question.
away because you're my only question for today. So first of all, I wanted to congratulate you because I always use Meriden as a great example that your costs are low per
Thank you.
pupil. So for an inner city that, has a big population, kudos to you to be able to do that because I would not expect that. I would think it'd be a smaller town, to be honest. So that's great. And I know the superintendent from Hartford also mentioned, we have been always a proponent to fully fund the excess cost. I think that that's extremely important. I think the state has never funded ECS fully. And so when people come and talk about putting more weight in the ECS funding, it's never been funded as it is. And I know school districts count on that money as to what we say we're going to give you, and we never give it to you. So I'm a little hesitant about that. I think we need to talk that really more in depth about the weighted into the ECS formula. But you were mentioning, and your time ran out, that you would be interested in forming some group to oversee. Where were you going with that?
I think that we need to look at how we're servicing kids, where we are spending the money, and whether or not it's reaching the quality that we're looking for. In that, it's, when you say something costs $150,000, like we have 10 students that are placed out that cost $2 million. 10 students that are placed out that cost $2 million. And so really understanding why, what's happening, and is it the quality that we're looking for? Is it the information? And then what can we do with that information?
Amen. I agree 150%. I would come back and say, aren't you doing that?
Yeah, so we definitely are. We're out at schools. I visit schools with my supervisor often. We're always looking at it from a kid-specific IEP situation. This is more of a step back and really looking at systems that we're using. So like, for instance, I always say with transportation, we're each individually looking for transportation to drive one or two students 20 minutes away, but could we have a system that helps us identify that there's a route so that we could pick up some students to make that cost better? Like, that's just an example of stepping back and analyzing the systems that are in place.
Agreed. And so I'm going to end soon, I promise, Madam Chair. So I would love to talk with you more. I think this is what this committee is tasked with, but should be tasked with. I don't think we have the answers. Y'all have the answers, and we need to get it from you. So I think this is a much deeper conversation than the 2 minutes, 1 second that I have left to talk to you. But I agree. So if there's a way I could reach out, I think we really need to dig into that. And that's what needs to be fixed.
Yes.
Not
system.
just constantly throwing money, because you don't always get the money.
Correct.
Thank you.
Thank you. Next, we have Allison Quirion.
Thank you for the opportunity to provide public comment today. First and foremost, I'm a parent of two beautiful boys, which are now young adults, one whom has dyslexia. Since 2013, I founded Decoding Dyslexia Connecticut. It's a volunteer grassroots movement that advocates for appropriate services and interventions for students with dyslexia through the constituent voice. I ask, as you put forth recommendations to the Education Committee, to consider who is addressing concerns when violations of federal and state laws arise. I'm talking about concerns that are looked at before the expense of advocates and attorneys, concerns from families and teachers and community members. This committee has a unique opportunity to not only look at special education, but to provide robust accountability. Senator Austin has introduced a bill, Senate Bill 873, which calls for an education ombudsman. I respectfully ask that you support raising this bill for a public hearing before the Education Committee. Several states have education ombudsmen. Some of their duties include handling cases with confidentiality and neutrality. This is important as many individuals are afraid to come forward. Individuals are scared to rock the boat. This goes for parents, teachers, and other community members. An education ombudsman in Connecticut could listen to and facilitate solutions prior to the expense of mediation and due process. This is important for so many of our families who cannot afford the tens of thousands of dollars to hire skilled advocates and attorneys. We should not just check off boxes to say we did things, nor pass legislation without full implementation and accountability measures. We need to ensure that actions we take are actually benefiting and beneficial in moving student outcomes. And if they aren't, we need to shift and adjust so our students receive the free and appropriate education they are entitled to. Our students and community so desperately need an education ombudsman in this state. I thank you for your time.
Thank you. Jennifer Zabatakis. Oh, we're good.
Hello, my name is Jennifer Zabatakis and I live in Tolland. My son attends Tolland Public Schools. When my son was in kindergarten, he started to show signs of dyslexia. When we brought our concerns to the school, we were told that he was smart and he will catch up. Don't worry about it. When we asked for an evaluation to be completed by the school, we were told that our son was fine. He was performing at grade level. My husband and I at that point decided to have our son privately tested. The private testing showed our son was severely dyslexic. When we brought our findings to the school, the administrator said they did not agree with our private testing, and they would not provide support or intervention for our son. At that point, my son was in second grade. My husband and I consulted attorneys and ultimately hired an educational advocate to get our son the help he needed from the school. We thought that we had turned the corner and that our son would start to benefit from the services from the school, but unfortunately that was not the case. The district did not have a teacher trained in structured literacy, which is a teaching method that breaks down literacy skills into systemic steps. Structured literacy is not only for dyslexic students, all students can learn to read using structured literacy. My husband and I hired a private tutor that was trained in structured literacy, as we could not continue to wait for the district to provide appropriate interventions. My son spent 5 years receiving tutoring and successfully passed a rigorous structured literacy program. My son is now a senior in high school, anxiously waiting to hear about college acceptances. When I recently looked at the cost to send him to UConn Stores, it struck me that the tuition and room and board for 1 year of UConn equals what my husband and I paid for attorneys, advocates, private testing, and tutoring just so our son could read. No family should have to spend $36,000 so their child can read. 1 in 5 people are dyslexic. Every single classroom in our state has a dyslexic student in it. My story is not unique. There is a Senate bill coming this legislative session that would create an education ombudsman. That's Senate Bill 873. An ombudsman would be able to act as liaison between families, districts, and the Connecticut Department of Education. This would not only help dyslexic students and their families, but all students in Connecticut. Had there been an ombudsman when my son was in kindergarten to listen and facilitate solutions, I think our journey would have looked much, much different. Please consider recommending Senate Bill 873 for public hearing, as it will help students and families. Thank you for allowing me to share my story. I appreciate today.
Thank you. Next we have Tara Mantis, and you don't have to, but if you can, it would help to mention what either town or district, but again, you don't have to. Yeah.
Hi, I've never done this before, so I'm a little nervous. I'm here to talk about reading as well. My daughter was diagnosed in 3rd grade with double deficit dyslexia. It is one of the hardest to remediate. I apologize. I'm here to support the Bill 873 of the Ombudsman and Bill 874 of bringing the K-3 screening statute current. I'm also an educator, and as an educator and a parent of a student who struggles to learn to read, I think early intervention is key. If she had gotten her diagnosis earlier, she would have been able to probably meet remediation and close the gap. And currently she is not closing the gap, and she is entering 9th grade. And this is very concerning. Also, I think it's important that with the Ombudsman that they will act as a liaison between schools and families and hopefully bring about evidence-based practices. It is important that we all follow the research. 1 in 5 students is a struggling reader, and we need to use these strategies and procedures that have been proven to have the biggest effect size. The other 2 areas that I think that it would be important for the Ombudsman is the training of all current teachers and supervisors in how students learn to read and why it is critical to use these proven practices. As I said, 1 in 5 students is a struggling reader, and we do not know who will be that struggling reader. So it's not about us or them. It's about all students and what helps all students. And bringing these practices into the general education curriculum help all students. Also, I think that it's critical that we take a look at our teacher preparation programs. I currently have 2 teachers who are in a program, and they are having a lesson in using how to do FNP and DRA. Those are 2 areas that we've proven that are not evidence-based research, and those practices need to stop. We need to only use programs that have evidence-based research behind them and the curriculum that uses philosophies that have evidence to prove why they are useful and effective. Thank you.
Thank you. I just want to, you did a great job.
Nope.
And thank you. This is not easy. So we're a community here. So we welcome and thank you particularly to parents for sharing very personal stories. And we're here, we hear you. That's what I just want to say, but thank you so much for saying that.
I just want to add too that, with, we were talking about money and saving money, and thank you. I feel a little more comfortable, but if we end up using early intervention and we ultimately save money down the road. And I don't understand why we still wait to fail, because waiting to fail is not, it hasn't proven to be effective. And we really need to target kids in preschool, in kindergarten, and use those practices. And school districts are not doing that. And
time is up.
Sorry.
No, thank you so much. And we're absolutely we're looking at this as a continuum and early education interventions. The task force has already even reported on that. Thank you for testifying to that too. Appreciate it.
Thank you. Next, we will hear from Steve Medancy, Superintendent of Southington Public School.
Good afternoon. Thank you for allowing me the opportunity to speak today. I just want to speak to a couple of the recommendations from the task force and how that could benefit communities like Southington. One of the things that sticks out to me, and I spoke with my Board of Finance about this last night, is the Education Cost Share Grant in Southington in 2015-16 was $20,568,000 in change. In the governor's projected budget next year, it's $20,592,179. So over 10 years, I'm projected to get only $25,000 more in state aid than I received in 2015-16. With the escalating costs to special education services and no ability to regulate the costs that are passed on to districts for outplaced students, what we're seeing is those costs are far outpacing the state of share aid we're getting. In addition to that, an area that I've advocated strongly for is reducing, and I think this gets to what the governor's proposal is, reducing the cost of outplaced tuitions by incentivizing in-district programs. And I've talked to a couple of you about this for several years now. Like Meriden, I'm very proud of the continuum of services that we have in Southington. Representative Poulos has come through and visited all of our programs, starting from our preschool all the way up to our age 22 transition skills programs. And we do it very well. But most of that investment has been on the backs of the taxpayers of Southington. Because we're controlling costs, we don't meet the 4.5 times threshold per student that it would take to realize any reimbursement back to the community. And so one of the bills that I believe is proposed is reducing the threshold for in-district programs to 3 times per pupil. But what I would add and stress and hope that can be considered is it's not just to incentivize the creation of the programs, but also to maintain the programs. To incentivize it only punishes districts that are already doing it and doing it well. And I also know that to create a program isn't a one-time expense, because once you have the program year over year, obviously, you're going to be responsible for the staffing associated with those programs. So I hope we can consider incentivizing and maintaining programs. Just as a aside, in terms of some of the actual data.
30 seconds left.
Some of the data in 22-23, we were eligible for $2,985,000 if it were reimbursed at the 88%, which is current statute in terms of us being in the second tier. We received only 76% of that, and we were shorted by $348,000. That was in 22-23. In 23-24, again, shorted by $680,000, $393,000, because we were only reimbursed at 69%. And this current year, we were reimbursed only at 62%, and that leaves us with a shortage of $1,178,000. We're not meeting the threshold for reimbursement, and we're not funding what it costs to actually, whether it's outplaced or in-district programming, to provide quality education to our students. Thank you.
Thank you. And I know we have a question.
Thank you, Madam Chair. I'm hoping that you could share a little bit more about how Southington, how the district has been impacted by the recent funding levels related to excess cost. If you want a little bit more time to provide detail, and also share anything that you do to control those costs that would happen in district.
So unfortunately, one of the things we have to resort to is when we build our budget, we are currently budgeting at a projected 65% reimbursement rate, because we've just never realized the 88% reimbursement rate that we're going to receive. But when we budget for that, yet we've added the staff year over year to create the continuum of services, the public officials, the elected officials that are responsible for trying to create the local budget see us as adding staffing and increasing costs, but not realizing that there's any reimbursement for the state. So again, that gets passed on to the taxpayer. And so that's created some friction in the community, because why are you adding staff year over year and asking for more money and more money? They're not seeing the cost avoidance that's associated with the staff that we're adding, because if we were outplacing these students, we wouldn't be adding these staff, and therefore it wouldn't be part of our operating budget. In terms of how we're addressing it, and that's how we're, basically absorbing the expected impact of not getting the full funding. We're budgeting with what we project to get. But in terms of the quality of services, I would say one of the most important points to make that we've talked about, other than the predictability of cost, is the quality of programming. When our students are educated in our district, they're under our purview, and we can ensure that they're getting quality services. And I think everybody can agree that if possible, it's best to educate students in their home communities with their peers, and sometimes provide them opportunities for extracurriculars, sports programs, and things like that, that some of the private outplacement facilities wouldn't provide for them.
Thank you.
Thank you.
Thank you. All right, next, we're gonna have Claire Nessarella, and I'm gonna try to do 10 in person, then 10 online, then jump back to in person, just so we know.
Hi, thank you for giving us this opportunity, and I'm also pleased that so many members of this panel are parents of kids with special needs or educators. I'm here on behalf of my daughter, Faith. Faith is a junior at Conard High in West Hartford. She is one of the students that exceeds the excess costs. She doesn't read or write. She's in 11th grade. But within the school and within the community that she's a part of, she is learning how to work with people. She's going to work at CVS. She's going to St. Mary's. She's getting all these experiences. She'll go to post-secondary, and she is going to be a contributing member of society. She will do good in the world. And that is why we're trying to do this. We're trying to get these kids not just the appropriate education, that's important, but what's really important is where do those kids go and what skills do they learn once they leave public education? And so we have to do all we can to meet the needs of the kids that are before us. In West Hartford, I'm also on the Board of Ed of West Hartford. We work very hard to make sure that any kids that are outplaced are there for real direct needs, and if they can come back, we try to bring them back. The rate at which they get outplaced, though, outpaces the rate at which we bring them back. My daughter participates in unified sports. She is in Special Olympic skiing. She has all these opportunities to be with her peers. The Unified Theater program has 160 kids in it, and only 30 have special needs. So the benefit of the kids in the schools that get to be with these kids with special needs, they grow, the kids grow, and 130 kids at Conard are not hanging out at night and going to theater practice to be with all the kids that have the special needs. There was a comment about misidentifying kids with English as a second language. I'm also a school teacher, and I know how hard the ESOL teachers work to make sure that the kids are getting the help they need with language. But many times I see the opposite effect where learning disabilities are not addressed because of the language barrier.
30
And
seconds
it
left.
takes a long time to get through all the ESOL work to finally say, okay, we finally now have a learning disability that we can identify. The other thing is, well, with the outplacement, it's very important that these kids aren't seen as those kids. Some of the outplacements are medical needs. They're fragile. We know that some kids can't have all their needs met. I'm very proud of the work we do in West Hartford.
Time is up.
But I just wanted to say, if we are now about 3.5 million over budget with the excess costs if we went to what is promised. Thank you.
Thank you, Claire. And I also just wanted to thank you for all you do. I mean, I heard parent, I think I heard Board of Ed member and teacher. So thank you for all you do. We do have a question for you, Representative Johnson.
Thank you so much for your testimony. And I have in my district probably the highest number of students with a home language that isn't English. And many times we get picked on because we are told that maybe that's not the actual problem. It's just a language issue. But when you have the issue of processing in both languages, when you have to answer a question, it does take longer to do that processing. And so it seems to me that the teachers might need to also speak the language that they're working in, and also understand some of the processing problems that might also go along with a learning disability. And I just wondered if you had any insights into that since you mentioned it.
Well, right now in the state, all teachers need special ed certification as well as general ed education. So we have a teacher shortage, though. There's talk of taking away that requirement. I know that most of the teachers I work with have a lot of background in special ed, But when I started in 98, I might have 2 kids in my class of 26, 27 in West Hartford. And now we're seeing a fifth of your class has special needs. And then on top of that, there's dyslexia, there's reading issues, and then you might have 2 or 3 kids that English isn't their first language. So a teacher in a classroom of 24, 25 kids is trying to manage so many diverse needs, and then you have the kids that need acceleration. So it's a very tough profession right now.
Great. Thank you so much, Madam Chair. Thank you for your remarks.
Thank you. Rebecca Shaban, the Shaban or?
Thank you very much for your time. I didn't actually prepare remarks like other people did, but I am a parent. I have 3 children. I'm here in the Hartford district. 2 of my children have autism spectrum disorder diagnoses. I'm very certain that our 3rd child does as well. Our middle child was struggling with challenging behavior coming into the public school system in pre-K3. So I was very excited to come into the public school system, having dealt with private institutions that were discontinuing their services with him. And I was excited about having a group that would partner with me and help me find solutions, help me find how to access the early intervention that I heard was so beneficial for children like my own. And I was shocked with the actual experience that I had. So I spoke before my son went into the school system with the vice principal, with his teacher. I set the stage. By December, they were willing to engage with me in a PPT. He had an IEP in place by January of 2024. But because of resources, the services that were in his IEP were either not delivered or delivered very spottily. Over the summer, he was supposed to also receive an autism evaluation. He was receiving services under speech. That didn't happen. Over the summer, things continued to devolve. So we paid for him to get a diagnosis. He was diagnosed as ADSD as well as ADHD. But when we came back into the school system in the fall, he was in crisis. And the school didn't increase his services. They told us all of the problems that they were having with him. They told us that we needed to do more outside of school. They didn't deliver the services that were in his IEP. And they suspended him and sent him home in pre-K. So our whole family was in crisis. I couldn't sleep. I wasn't eating. Our other children were being impacted. We didn't know what to do. So we pushed back. We hired an advocate. We set up for our son to receive 25 hours of ABA in school through our financing. And
30 seconds left.
Behavior is much reduced. The school is trying to do more, but there's just clear resource deficits. And not all families can afford to do what we've done. Our son is high need now, but he's not high need overall. I think it's so important what people are saying about early intervention, just being able to help children early so that there aren't problems later. It does involve highly qualified staff. I think SPED funding really should be kept for the SPED budget.
Time is
because
up.
It will go through, and in-district resources are so beneficial. So thank you very much for your time.
Thank you. You may not have prepared remarks, but your remarks were on point. Thank you. Tom Kosker.
Good afternoon, Senators and Representatives. Thank you for having me today. Tom Kosker from Rocky Hill, Connecticut. I'm a parent of a 16-year-old son with multiple disabilities, also a freshman in college who would be in trouble if I didn't mention her name, or mention her. I'm also a disability advocate at Disability Rights Connecticut, but I'm parent first. A few things. Quick story is my son was first or second grade, had a lot of challenges, intellectual disabilities, speech challenges, communication challenges. And we brought him to a school. We were considering outplacing him at a school. And I'll be brief because I only have 3 minutes. Long story short, we were driving home from that visit, and he said to us, and he didn't have a lot of words at the time, "I belong at West Hill," which is our home school. He's never left the district. He's been in district the whole time in Rocky Hill. He's a junior in high school. Much to some other parents that presented today, he reads at a second or third grade level. He has a lot of needs and a lot of supports. His involvement in the community, from unified activities to everything in classrooms and unified classrooms, has been amazing. As a disability advocate, I can say I would hope that can be done for every student in Connecticut, or as many. I acknowledge that there are students that have higher support needs and need outplacements. I grant you that. We, as a state, have the highest rate of outplacement of students out of district in the country. Okay, we outplaced about 6.3%. The national average is about 2.4%. It's a couple years dated data, but I can get that information for you guys if you need it. Also, for students with emotional disabilities, a lot of behavior challenges, etc., those students are outplaced at a rate of 28% in Connecticut, as opposed to a national average of around 10 or 11%. So the numbers are pretty stark in Connecticut. We like to be first in a lot of things. These are not things we should be first in. Around that outplacement stuff, I think there's a lot to that. One is the oversight and enforcement, or oversight and monitoring of those outplacement schools. We have a system in place. The Connecticut State Department of Ed does oversight and monitoring those schools. There are some issues with that in terms of enforcement, right? The State Department of Ed will monitor, provide corrective actions, etc. There are some improvements that can be made in that system because we see the same corrective actions being requested, recommendations being requested year after year. It's every 3 to 5 years they do this approval process. That shouldn't be happening, right? We shouldn't be having the same things coming up over and over again. So again, just a couple of points. The last point I want to make, because I'm at 2.5 minutes, I'm timing myself.
30 seconds left.
I should get a bonus 30 seconds. The last point is unrestrained seclusion. So it's another area that really concerns me as an advocate. Again, students that are placed out of district are being placed here because their needs cannot be met in district. They shouldn't be. They should be going to a place that has quality services with, board certified behavior analysts, et cetera, behavior plans, all those things in place, so that students aren't subjected to overuse of restraint and seclusion. We've adjusted those laws in recent years. Thank you. We've adjusted those laws in recent years to change the definition.
I want to get one thing.
And so anyway, just to close, I'm not sure who's talking, but just to close, yeah, I think we need to do a better job looking at those schools that have high rates of restraint and seclusion, and what can we do to help them, right? There's reasons that those things are in place. Certain schools have very high rates. Other schools, including outplacements, are doing a really good job and have really low rates. Thank you.
Thank you. Thank you, Tom. Okay. So I want to make 2 reminders. One, just that folks that have come into the room, if you have not signed up to speak, we don't know that you'd like to speak. We do have a QR code at the clerk's desk. You can go over and scan the QR code to register to speak. So I have your name up here. I'm going to move now to some of the folks we have online. So the first person I have is Jennifer Benevento. Actually, I'm going to call I'll kind of do a standby so folks are ready.
Hi,
Mary Gordon is going to be next.
I'm sorry, can you hear me?
Yes. Go ahead.
Okay, it needed me to join as a panelist. I apologize. So greetings, Representative Khan, Representative Corus, and senators. Thank you for convening this listening session today. My name is Jennifer Benevento, and I'm a resident of Bristol, Connecticut. I'm also the mother of a special needs child who receives special education services from the Bristol School District. I'm here today to express my deep concern about the underfunding of special education in our state and its growing impact on our students and communities. Special education is not a luxury. It's a critical part of our education system. Nearly 20% of students in our district require specialized services, yet we are seeing severe shortages in funding, personnel, and resources. This has resulted in larger class sizes, delayed services, and an overall decline in the quality of education for children with disabilities. These students have unique needs, and without proper support, they're not able to thrive or reach their full potential. What's even more troubling is the way this underfunding is leading to division within our communities. Instead of working together to solve this crisis, some members of our local boards of education are engaging in political finger pointing. They accuse the other party of financial mismanagement, painting inadequate funding as financial malfeasance. This divisiveness only harms the children who need support the most and distracts from the real issue, a system that's chronically underfunded and failing to meet the needs of all students. This political blame game also fosters a damaging narrative in our communities. When special education is underfunded, it sets up the idea that children with disabilities are a financial burden, something to be resented instead of embraced. This narrative is harmful not only to these children, but also to their families, who are already struggling with the stigma of raising children with special needs. We need to shift away from these divisive narratives and focus on holistic changes to our education system. The needs of our children have evolved, and our educational system must evolve with them. Today's students are more neurodiverse than ever before, and if we are to support them in meaningful ways, we must acknowledge that change is necessary, not just in how we fund special education, but in how we approach it as a whole. It's time to stop framing our children with special needs as a burden and start seeing them as an essential part of our future. If we do not take action now, we risk further alienating students who are already vulnerable. These are our kids, and they deserve the same opportunities to succeed as their peers. I ask you to invest in our children, to invest in special education, and to create a system that's truly equitable for all. Thank you.
Thank you, Jennifer. Thank you. And thank you for pointing out some of those facts, especially the pitting people against each other. I think it's important we do realize kind of what we're dealing with here. Next, we have Mary Jordan, and on standby, Leslie Blateau.
Thank you very much. My name is Mary Jordan. Greetings, Co-Chair Khan, Co-Chair Gadar-Wilcox, and honorable legislators. Thank you for convening this listening session so we can all improve special education services in our state. I'm a certified teacher and union president testifying today on behalf of Newark Federation of Teachers, AFT Connecticut Local 1723, advocating for urgent improvements in Connecticut's special education system. We strongly support adjustments to the ECS formula to weight for special education services, as well as the establishment of caseload and programmatic guidelines. CT said service hour estimates can help inform these guidelines. Additionally, clearer definitions are needed. A classroom where 90% of students have IEPs should not qualify as a mainstream environment. Co-taught classrooms also must include shared planning time for co-teachers. Financial incentives would encourage districts to develop in-district programs that reduce costly outplacement. I heard with great interest the descriptions that the parents had of keeping their students in-house, and there is a need for quality outplacements for others as well. Norwalk, my district, has successfully created many programs to keep students in-house, but these programs require proper funding and oversight. They can be really good for students if they are run well. Expanding and fully funding the excess cost grant will help districts better serve outplaced students, and we welcome your help in regulating and preventing unchecked tuition hikes at outplacement centers. A December 2024 survey of our members here in Norwalk revealed that special educators are 3 times more likely considering leaving their positions by year end. And this aligns with broader trends and highlights the urgent need for solutions. When asked what would cause them to consider staying, here is what they commented: clear policies that must be adhered to, consistent administrative support, competitive salaries, manageable workloads, and sufficient time for compliance and planning. Many educators described ethical dilemmas involving oversized caseloads and insufficient time for paperwork, all of which prevents them from delivering the services students are legally entitled to. Frustration and burnout is fueling high turnover, which is our most pressing issue, creating a cycle that further destabilizes special education services. The more we lose folks, the worse it gets for those who remain, with higher caseloads, fewer who know the protocols, and have a network
30
of
seconds left.
The more new people to train and bring up to speed over and over again. The differences between districts are big, but with funding and guidelines, we can improve equity for students across Connecticut. With the improvements that are being discussed here, special education teachers can more often conclude that they are a part of a system that supports them to support students. They may stick around and be cheerleaders for those who wish to enter the profession. We deserve more stability in this particular workforce.
Time is up.
And thank you for all you are doing.
Thank you, Mary. I will also ask if you could send some of, because you had some really good stuff in there, especially in regards to feedback that you received from special education teachers there on retention. If you could email that over, I'll make sure that that gets to the rest of the committee. But
Thank you very much. I will do that.
Thank you. All right. I think we had Leslie, and then on standby I have Hernan Flom.
Hi, can you hear me?
Yes.
Oh, here we go. Join as panelist. Okay. Good afternoon. Thank you all for the opportunity to testify today. It really is such an important issue, and we are really grateful for the opportunity to convene. My name is Leslie Blateau. I'm the president of New Haven Federation of Teachers, divisional vice president for pre-K-12 at AFT Connecticut, and the steering committee chair for the Connecticut for All Coalition. And I joined in person in Bridgeport on Tuesday. And one of the takeaways from that meeting was the unity among teachers, students, parents, elected officials, administrators, all really saying a very similar message that our special education system needs more support from the state of Connecticut. We know that we need funding. And the good news is the state of Connecticut has the resources to be able to provide this funding. We know that if we shift the fiscal roadblocks, we will be able to deliver significant funding to towns throughout this state, suburban, rural, and urban, so that we can really make a difference in the lives of our special education students. We are specifically asking for revision to the educational cost share formula that will add weights for special education students. And I've been talking to a lot of social workers in New Haven. So this is not just an issue that impacts our special ed teachers. This is an issue, obviously, that impacts regular ed teachers, because we want to deliver high quality instruction to all. And it impacts our related service providers. And just a few examples of what social workers are going through right now. Quote, when I started out as a school social worker in New Haven in 2002, I had a caseload of 20 students. Today, my caseload is over 50 students. And I see 10 more regular ed students on a consistent basis, bringing it up over to 60. And that doesn't include the crisis cases that often happen. So sometimes a crisis case will happen. A social worker will have to go to the emergency room to follow a student. They are the only licensed mental health provider in their school. If they are leaving to support a student and family, there's no one left back in the building to support students. We need more than just one social worker in a school of 400 students. Another example, quote, as a school social worker, I'm responsible for many duties of part of the special ed team. I attend all PPT meetings. Prior to the PPT, I must update present levels, strengths, concerns, impact, create the goals and objectives. I meet weekly with every student.
30 seconds left.
Small groups. I could go on and on with these examples. This same social worker completed 30 initial triennial evaluations during the last academic year, attended 104 PPT meetings, and ended the year with 46 students on their caseload. You know, the numbers are exhausting. There's a reason why these social workers aren't logging on to testify, because they're probably doing paperwork or going home to rest with their own families as a result of the intense work that's leading to.
Time is up.
Thank you for the opportunity to testify. Thank you for making this an issue in our state. We really appreciate your leadership on this, and we look forward to the work ahead.
Thank you. Thank you, Leslie. Next, we have Hernan Flom, and then Robin Boschman. For folks online, when I call your name, the clerk sends a message for you to accept a panelist. So you do have to click something before you're promoted to panelist. So just look for that. Thank you. Hernan.
Hi, thanks to the committee for this opportunity to testify. And I'm speaking as the parent of a 4-year-old child with special needs. So my daughter is autistic and she attends a magnet school, Craig School in Wethersfield. Unlike some speakers who preceded me, fortunately, our experience with the special education so far provided by the school has been extremely positive. I mean, they're very highly supportive of us and especially of her, and a pleasure to work with as well. Although obviously we recognize that it's not the situation for everybody. So first of all, I just wanted to acknowledge the great work that all people in the system are doing, particularly special educators and paraprofessionals. And among other things, echo the findings of the task force that call for providing these workers and particularly paraprofessionals a living wage such that they may be able to continue with these services. Finally, just to make my intervention really short, I want to speak about what's been perhaps the main challenge of our educational journey, which has begun only about 1.5 years ago, and that has been related to the extended school year. So last year, our daughter attended extended school year for 4 days a week for 3 hours a day between 10 and 1 at Newington Public School. And this year that was cut to 2 days a week for 3 hours a day. So not only is this obviously it means that she's getting less in-school services, which are essential. So her special needs do not stop just because the school year ends. But also it is an additional burden to working families to have to figure out a work around our schedule to drop her off and pick her up, because when she's not ready to travel by bus, and we also don't want kind of cost that presents as well. So I just want to put that out there for considerations, and then just echo the main comments of parents, educators that have preceded me, and thank you for having this discussion. Thank you very much.
Thank you. All right, next we have Robin. And then on standby, Heather M. Let's see, Robin is still there. Robin is.
She's rejoining right now.
Okay, so Heather, why don't we, oh, there.
I'm here. I'm
Oh.
sorry. I got kicked
No
out.
problem.
for a reason.
Next already comes in. No worries. Go ahead, Robin.
Good afternoon. My name is Robin Bushman and I live in Southington, Connecticut. Kindergarten, first grade, second grade, third grade, fourth grade, fifth grade, sixth grade, seventh grade, eighth grade. 9 years in our public school system. That is how long it took to figure out that my son had dyslexia. For context, until he had an outside evaluation that diagnosed his dyslexia, he never had anything more than a 504. During this time, I could not work because my son was refusing to go to school. Because every day that he showed up, he felt inadequate. The school trauma is so embedded in his brain that now as a senior in high school, he is on homebound tutoring. And as I watch all the fun activities the seniors in high school are enjoying, I'm watching my son sit home missing out, and he's about to graduate. Feeling so let down by our public school and feeling like he could not do what all his peers could do, which was learn to read. And it all started because I sent my 5-year-old son to school with the expectation that they would return him a proficient reader. This is just one story of many. It is estimated that 1 in 5 children are dyslexic, and Connecticut is really missing the mark. If I could pick 2 things that I thought are the most important things to discuss. Number 1 is Senate Bill 873 to establish an education ombudsman. This is such a great idea. As part of our dyslexia journey, I took some advocacy courses. The number of phone calls I get from parents that don't have the means to hire an advocate is disturbing. And what happens to those children? And why is it that parents must spend their savings after paying taxes just to get their child a free and appropriate public education? The second one, and I'd like to give credit to Diane Wilketts for this, is there a requirement that all K-3 teachers, special education teachers, and reading specialists take a course on structured literacy that includes a supervised practicum. Ideally, this would be Orton Gillingham. This could help identify our struggling readers earlier, and it would give our struggling readers the appropriate instruction from the start during the most crucial time in their school career. K-3 is about learning to read. 4th grade and beyond is about reading to learn. Let's make the goal that these kids go into 4th grade reading proficiently. If we could do that and do that right, the need for outplacement would decrease. Thank you.
Thank you. Next is Heather, and then on standby, I have Shannon Leary.
Hi, good afternoon. My name is Heather McCann, and I'm a parent of a child who received services. This is my son, Declan. And I'm here to share my story, or share our story, and ask for revision to the educational cost-sharing formula to include special education students, caseload caps for special education teachers and related service providers, and expansion of the excess cost grant to better support our students with special education needs. I'm a member of the Connecticut Parent Leaders Roundtable, a graduate of the last Partners in Policymaking program, and a parent leader of our local Special Education Advisory Council. However, my most important role is that of a mother. We were incredibly fortunate when my son Declan was identified early in his educational journey as a pre-K student at Wintonbury Magnet School. Despite the dedicated efforts of the staff at Wintonbury to support my son, who was experiencing meltdowns, elopements, and struggles to stay engaged in his learning, they were not equipped at the time to provide him with the specific support he required. Through early referral and collaboration with our local school district at that time, West Hartford, a thorough assessment was initiated, resulting in his identification with autism. Subsequently, he was placed in special education in West Hartford, where he completed his preschool experience with appropriate interventions in place. This timely identification in school was crucial, as any delays would have hindered his learning at this critical point in development. When we relocated to Tolland during his 2nd grade year, the transition was smooth and services commenced promptly without interruption. We were particularly grateful for the in-house program for students needing extra support beyond traditional programming. This program allowed Declan to learn alongside his peers and have access to a quieter space, support, and resources when needed. Then again, he was able to join the general education classroom when ready, and which is crucial because these children are first and foremost part of the general education setting. He required a paraeducator's assistance until 7th grade, but as an 8th grader now, he no longer needs one-to-one support. The collaborative efforts of his support team, family, educators, special education specialists, and external resources have been pivotal in his progress. He has built friendships with typically developing peers and those with unique learning needs while also excelling academically. Early intervention, seamless continuity of care, diverse services, a skilled support system, and inclusion in the gen ed classroom have been instrumental in shaping him into the bright, happy, and academically successful young man he is today. I'm confident that without early interventions and consistent care, he would not have thrived as he does now. Conversely, he has positively influenced his peers by providing mentorship in the gen ed classroom. I acknowledge our story comes from a place of privilege. My son has access to pre-K schools, early intervention, and early identification. I'm thankful that he was identified when he was. Things are changing, needs are changing, and more children are struggling. Due to the divestment in our schools, I have witnessed burnt out educators who are overloaded with class sizes and caseloads. This is lending itself to challenges in retaining and recruiting teachers and supporting staff. The divestment in our schools will continue to erode our students' education. More students will fall behind academically.
Time is up.
Will need special education services that will not be as readily available, and the students will struggle to succeed in school. Thank you very much for your time. Appreciate the listening tour.
Thank you, Heather. And I assume that that's your son that was next to you. So hello and thank you for
Yes,
being with us. Thank you.
absolutely. Thank you.
Yes. All right.
The next to speak is Shannon Leary.
Good afternoon, everyone. I'm not sure if you can hear me or see me. Okay, great. Good afternoon, and thank you so much for convening this important commission. I have been around the LOB for about 20 years doing advocacy work on behalf of people with disabilities. So some of you may know me from that. I do see a lot of familiar faces, so thank you for being here. Just for context, I now have a 23-year-old son who is diagnosed with autism. I, again, as I said, worked to pass autism insurance reform about 15 years ago, along with other legislation. So now I have my own business in Simsbury as a special education advocate, helping parents, caregivers navigate the quagmire that is special education. I did attend briefly one of the last meetings that sort of raised some flags for me about the burden of proof. For historical context, again, this issue comes up almost every legislative session. And just as an indicator of how long I've been around, Representative Andy Fleischman was the chair of the Education Committee many years ago when he said we would never change the burden of proof in Connecticut. But yet every year advocates are fighting to defend our families against this burden. While school districts may be burdened with funding district lawyers, they do have a funding source. Most families, as you've heard, impacted by disabilities do not. And in knowing this, school districts often become bullies as they exhaust families' options. Additionally, in many cases, outplacement is the result of a school district's inability or sometimes unwillingness to provide a free and appropriate public education, FAPE, as afforded by the IDEA. And I would just like to reiterate that the IDEA is the overriding federal guideline to help us navigate educating our students with special education, just as we educate our students in general education. I realize that the funding source for implementing IDEA is compromised, as it is only funded as a rate of about 19%, but this does not alleviate the need to educate our most vulnerable students. Parents and caregivers aren't asking for extraordinary measures.
30 seconds left.
At least in my case, my clients are asking for equal access to education. If they've hired me or a lawyer, they are already taking on an incredible and likely finite financial commitment. They cannot outfinance a school district. I am happy to discuss further, given the current federal administration's initiatives to potentially eliminate the Department of Education. I would hope that Connecticut would advocate to protect students and parents as much as possible. Thank you so much.
Next to speak, we have Victoria Seelan, and on standby is Sarah Swetzoff.
Good afternoon, everyone. My name is Victoria Ceylon, and I wear many hats within Connecticut here. I am a Board of Education member in Region 12. I'm a paraeducator in the city of Danbury, and the most important hat that I wear is being the mother of two children. My 23-year-old son, AJ, has cerebral palsy and started out at age 3 in Danbury Public Schools. Without the education that he received in Danbury, without the support of paraeducators and the special education department, my son would not be where he is today. He is a proud UConn graduate, and he now attends the University of Florida, where he is getting his doctorate degree in audiology. He does have cerebral palsy, so he has multiple challenges on a daily basis, but that never stopped him. Paraeducators play a huge role in our special education community. I became a paraeducator to give back to the community that gave to my son. We work beyond hard, harder than anyone can imagine on a daily basis. We are understaffed and we are way underpaid. And it's important that we try to get as much money back into the special education community, into our schools, to help pay paraeducators a living wage. Not only that, we want to attract quality workers. We want to attract people who are going to empower our special education students to be the best that they possibly can be in their life. And without that empowerment, children like my son AJ would not be where they are today. And for the families who don't understand the laws, who don't understand how to advocate for their children, we're doing them a disservice. We need to put quality paraeducators in the rooms to support our amazing educators, and we need to help our students as much as possible. So please understand that this is imperative that we get more money to the schools for special education. Thank you.
Thank you. And Victoria, I just want to say thank you, you as well. Wear many hats. And I think your Board of Education especially is very lucky to have that experience on a Board of Education. I myself as a Board of Ed member, as are many members of our community, often people that work in the field of education are not always usually actually Board of Ed members. So I'm really glad that you bring that experience and then your experience as a parent. So thank you for all you do.
Thank you.
And thank you for your testimony. All right.
Next to speak is Sarah Swetzoff, and on standby is Jeremy Farrell.
Hi, this is Sarah. I'm going to read the testimony of Perla Viescas, who wasn't able to be here with us today. My name is Sarah Swetzoff. I'm the education organizer at Make the Road Connecticut in the Hartford office, and I'm also a disability parent. As you can hear, my child with Charge syndrome clapping for my attention in the background. This is the testimony of Perla Viescas that I translated from Spanish with her. My name is Perla Viescas. I'm a member of Make the Road Connecticut and the Connecticut for All Coalition. I have 2 children with IEPs here in Hartford. My son is 16 and attends Oak Hill, a specialized school for autistic children. My daughter is 13 and attends Batance STEM Magnet, where she receives special education services related to academic support and mental health. It's very difficult to access good services for children with special needs here in Hartford. My son started at Burns Latino Studies Academy. One time I was arriving at the school to pick him up and I found a security guard pinning him to the ground. After Burns Latino, he attended McDonough. I started working with a lawyer at that point. At McDonough, it was even worse. There was an incident where he ran out from the school into the street, and another incident they took him to the hospital. He didn't have shoes on and his legs were restrained. This was truly traumatic for us. Both schools lacked a sufficient number of teachers and personnel who are qualified and trained to educate kids with autism like my son. It's really too bad because I liked the academic opportunities he had at McDonough, and it had the additional advantage of being close to our home and in our community. But for the reasons I already mentioned, he couldn't stay there. After pursuing legal action, my son went to a specialized program in New Britain. It was completely different. They had lots of qualified personnel who maintained routines and strict protocol. It was good there. They never called me to pick him up and he was happy. I had great communication with the school thanks to one of the social workers who spoke Spanish at an excellent professional level, and she would call me every week to update me. Now my son is in the autism program at Oak Hill, and it's really nice, but the problem is that communication with the school is almost non-existent. None of the teachers or other personnel speak Spanish at a professional level required to communicate about his education. It's very difficult for me to communicate. There's no regular weekly communication. I have to go in person, and then they just bring out one of the paraprofessionals to translate on a very limited basis. The school also lacks the bilingual culture we have here in Hartford and in our home. My son has autism, but this doesn't negate the importance of his culture and identity. Research has shown that identity is important to the development of young people. My son speaks in both English and Spanish. He has the right to bilingual education with cultural competency, just like all of the Hispanic children of Hartford, and just like I have the right to language access as a parent. Why do we as a family have to choose between critical disability services, the safety of our child, and language justice in our community? Hartford deserves the resources needed to keep kids like my son in our local community schools. Hartford deserves the resources required to offer students with autism great programs in the same schools that their siblings and neighbors attend. And Hartford deserves the resources to maintain and grow bilingual education programs for Hispanic students and their families, regardless of whether those students have disabilities or not. Thank you for listening to my testimony today. Right. Thank you very much.
Next to speak, we have Jeremy Farrell, and on standby is Ariana Kosmides.
Hello.
My name is Jeremy Farrell. I am, at the age of 4, I was diagnosed with autism, a learning disability, and many of the other typical diagnoses that come with it, like ADHD. I grew up in Brookfield in the Connecticut school system, and as an adult, I'm a professional autism advocate, working directly with individuals and traveling across the state, speaking to schools, parents, professionals, and autistic individuals themselves about self-advocacy in various ways. The things I'm about to share are things I've learned throughout my life and career, and that I've learned from others who I've talked to throughout this process. The first thing I want to mention, and I am very thankful that we are having that this space exists in the first place. First thing I want to mention is support for staff. This is something that everybody knows, but support for staff is very, very crucial in this space. For paraprofessionals especially, I have heard too many situations where paras have been put in positions where they need to either provide subpar, possibly illegally subpar services, or leave. And that is not a position to be in because they care about the people they work with. And this lack of ability to navigate this system doesn't just lead to poor morale for paras. I've spoken to many teachers who see paras as the heroes of their classroom, the people who come in and make things work, who know what they're doing when the teacher runs out of their expertise. And seeing paras treated the way they are, especially with the low pay, affects them as well. They start to lose morale as well, seeing that this system is not being supported the way that it needs to be for the kids they care about to be successful. Another important point is navigating the systems that are available. An educational advocate is becoming a crucial piece of getting the services that are available. It does not matter what services are available if you don't know how to navigate them. And navigating them cannot come at a premium. It needs to be offered to everybody. Everybody needs to know not only what services are available, but what it looks like to access them and what that process is. We also need to make understandings for different languages and cultures. We've talked about languages, but the culture piece is also really important too. I've talked to families who have come here from places that have completely different understandings of disability, places that don't talk about neurodiversity or talk about autism in very different ways, and meeting them where they're at, where their understanding starts, is crucial for helping them navigate this process. They are not coming with the exact same understandings we may have having grown up in this exact space or in a specific culture. And lastly, when we're talking about special education, I think we need to focus on spaces for growth and acceptance. We really want to focus on academics, and especially when special needs children are having difficulty with academics, we want every resource focused that way. But school is really important for kids for a variety of reasons. It's not just academics, it's making connections, making friends, learning how to interact with teachers and mentors, and special ed children need to have those abilities as well. And that comes from creating spaces where they can simply grow and exist through those other things and not having everything focused purely on the academic side of growth. I've seen too many individuals make it very far without having built those skills because people didn't help them build them. Thank you so much for having me today.
Thank you. Next to speak, we have Ariana Cosmides.
Hi, greetings. Thank you for convening this listening session so we can improve our special education services in our state. I'm so glad we're having this timely and important discussion. My name is Ariana Cosmides. I'm a New Haven resident and taxpayer, New Haven Public Schools parent, mom. I'm picking up my kids from school right now, and a New Haven Public Schools social worker at Wilbur-Cross High School. I'm a school social worker and member of the New Haven Federation of Teachers, and just really glad that we're having this discussion. It is so important. I'm testifying today to ensure that funding for our students with special education needs in New Haven Public Schools increases. I work in a large city school in New Haven with students with increasingly complex special education and mental health needs. We need caseload caps for special education teachers and all related service providers. I'm talking about social workers, school psychologists, speech and language, all our related service providers, especially shout out to our related service providers who have to go to multiple schools and, you know, Monday, Tuesday at one school, end of the week at another school. So I'm very proud of the work my teacher colleagues, admin team, and related service team do, but we face funding inequities that need to be addressed in the special education world. Thank you very much for listening to me while I pick up my kids from school.
Thank you. Thank you, Ariana. All right, we're gonna now move to folks in person, and then I'll come back to folks online. Reminder for folks in person, if you'd like to speak, you need to scan the QR code. I think there's a piece of paper there that has QR code. There's also one at the clerk's desk, so that you can sign up to speak. And then for folks online, I will come back to Zoom, but you need to raise your hand so that we know that you are interested in speaking. All right, with that said, our first speaker back here in person is Lisa Nee. And then on standby after that, I have Rachel Turner. Thanks.
Hi, thank you so much. I'm Lisa Nee. I'm a former board member of Disability Rights Connecticut. I'm also on the board of the League of Women Voters because I'm pushing disability rights as it applies to some of the causes they're into. So, if we want better results for adults, we need better results for kids. And transition, that super important time between the ages of 14 and 22, is that bridge to adulthood that determines if they are going to be able to lead a successful, independent, and happy life. And what I have found is we are failing there. The outcomes are not matching the financial input that we're putting into it. If transition was a business, it would be out of business. So what I wanted to do is kind of drill down and speak to some of the people who don't get a voice. And we've heard from some of the parents today, but I created a survey both in English and in Spanish. And here we go, I'm done. And what we found is, look, I just started this, so I'm happy to have 85 respondents at this point, but we cannot deny the data on those 85 respondents, and I'm hoping for 300, but like I said, we just got started. Of the 85 of the entire group of respondents, 99% of those people said that a parent's involvement is critical to the success of a child's transition. So you ask that same group of people who said 99% said that involvement by a parent is crucial. You ask that same 99% of what is the biggest barrier to them being involved, and they will say communicating with the school. There's secret handshakes, there's smoke and mirrors. I can't get off work. I don't understand the gibberish. They're talking in lingo I don't get. And so we get this huge resource of people who want to help and are critical to the success of a transition, and they're
30
being
seconds
shut out.
left.
And I think you hear that from all the people here. I have a lot of other data that kids, the majority of kids feel scared about their future is coming up. Also, I walk the walk. I'm a parent of a child with an intellectual disability and autism who was told we better get him ready for group home living. And that is when I quit my job. And today, fast forward, he's a full-time auto mechanic.
Time is up.
With benefits and a 401k. We need to create a position that is specifically dedicated to helping parents that does not report to the school. You can get that money by not having as many kids be outplaced because the parent is involved, and not as many kids going off the cliff without employment or independence or a social life, which when you ask the kids, that's their number one concern about the future is, will I have a social life? Thank you.
Thank you. Let me say thank you to my fellow member of League of Women Voters. And thank you for pointing out that education has a direct link to democracy. Supporting education supports democracy. Thank you.
Okay, thank you.
Lisa, I just have a quick follow-up. So I think some of what you're speaking of is transition post-grad, post
14 to 22.
14, 22.
It starts
But
when you're
planning for,
14.
yep.
But what we're finding is the majority of the respondents say, nobody asked me what my strengths and interests are. So if you don't know what that student's strength, they said to my son, you better work in animals because that's where we have connections. From day one, he had been making car noises. You know, he may not be able to read, but man, he can put a car together. And because of that, he qualifies for DDS services. So as I said, if you look at that child on paper and you have that low expectations, he would be cleaning cages at an animal shelter, which is nothing, there's nothing wrong with that, except he's an auto mechanic. You know, we can't keep saying that only because I have a relationship with animals or packing bags at the grocery store or stocking shelves, those are all great jobs. But I also know a kid who wanted to install ceiling fans, and he is washing dishes in a nursing home. Again, you get paid for that. That's cool, but that's not what he wanted to do. And that transition time is supposed to identify strengths and passions and interests. And if we are not setting the bar as high as we can, we will never meet the bar of successful adults going out into the world.
Thank you. Thank you, Lisa. I mean, this is absolutely something that is on our radar now, but has been on our radar. We tried to see some of it that we could address a couple years ago when we worked on our bill for adults with intellectual disabilities. And so how much of it we address through this bill, I'm not sure, but it is absolutely on my radar. I know I was here when we did that one. I think a lot of it is also our interconnection between our agencies, and then obviously that would contribute to the continuum of care for students that we have in our system. So thank you for providing testimony. We have your email, so if we need follow-up, we absolutely will.
Yeah, and I feel for the parents whose hearts are broken up here talking about their students. I sat in the same place. So
Thank you.
Thank you.
Thank you for the props as well. All right, Rachel Turner. And then on standby, I have Anthony Gasper.
Hello. Thank you. Sorry if I seem nervous. These are adults here. I do not have kids. I'm a ninth grade special ed teacher at Hartford High School, public high school. Thank you for giving me the opportunity to speak. It's an issue that affects not just a segment of population, but the very heart of our communities, especially Hartford, the funding of special education in Connecticut. Ensuring equal opportunity, adequate funding for special ed ensures students with disabilities receive resources, support, and individualized instruction that they need to thrive academically and socially. The support aids not only the students, but teachers in the proper and adequate instruction. Special education funding is not just a line in a budget item, it is an investment in our future. Another reason is special education is a reason it's special. It's tailored to meet the individual needs of students. It goes beyond a one-size-fits-all approach by offering personalized instruction, specialized resources, and support services designed to help students with disabilities succeed academically, socially, and emotionally. It emphasizes inclusivity, adaptability, and the recognition that every student learns differently, ensuring that all students have the opportunity to reach their full potential. We have over 59 languages in Hartford Public Schools, an array of disabilities. Having the proper funding ensures every student gets what they need to learn. Under the Individual with Disability Act, IDEA, states are required to provide free, appropriate public education FAPE to all students with disabilities. Insufficient funding can lead to noncompliance with federal mandates, putting our state at risk of legal consequences and, more importantly, failing our students. Special education professionals require special training, resources, and support to effectively meet the diverse needs of our students, as well as transitional support for goals. It starts at age 14, which is 9th grade. All of my IEPs have to be written with transitional goals that we definitely, as educators, need more support in. Proper funding ensures that teachers are well equipped, reducing burnout, turnover, and fostering a more stable learning environment. Currently, in Connecticut, we face a huge staff shortage. of special education staff, including teachers, aides, and specialists. Paras are crucial. This shortage places an additional strain on existing educators, leading to larger caseloads, diminished individualized attention for students. Adequate funding is essential to attract and retain qualified
30
professionals.
seconds left.
Offering competitive salaries and professional development opportunities, and supporting working conditions to ensure our students receive the quality education they deserve. In Hartford, we are currently in need of special ed teachers, speech pathologists, social workers, and paras. By funding, there's a revenue, an avenue to provide appropriate support. Investing in special education now can lead to significant savings in the future. By providing appropriate intervention early on, we can help students become more independent, successful, reducing the need for costly support services.
Time
for
is
their
up.
lives. Thank you.
Thank you. Next, we have Dr. Anthony Gasper. And then on standby, I have Sarah Fennessy.
Good afternoon, Representative Senators. It's my pleasure to talk to you today. I'm Tony Gasper. I'm the superintendent. It's my privilege to serve the 9,900 students of New Britain as their superintendent. So I did have prepared statements, but you've heard a lot of what I had planned to say before, so I'll endeavor to give you some additional context. We have the in-district programs that you've heard so much about. We have specialized programs for students with autism, for students who need behavior supports, for students who are medically fragile. We have an excellent transition program in partnership with Central Connecticut State University. For those programs, I'm out of classroom space. I literally have no further classroom space to expand those resources. They've been already expanded. I want to talk obviously mostly about the financial impacts. My current local budget given to me by the municipality of New Britain is $128 million. Using the state's formula for how to calculate the cost of special ed based on our EFS report, of that $128 million, $57 million is dedicated to special education, 44%. I want very desperately to continue to provide high quality services to the young people of New Britain, especially those who have disabilities. I want to tell you what some of the things are in our 11.4% requested increase. Now, no superintendent in his right mind wants to request 11.4%. And my courageous board chair over my left shoulder here, neither does she want to present that to municipality. We have requested an additional 5 BCBAs, an additional 20 paraeducators, a school psychologist, 2 social workers, and 2 special education teachers for a total of 2.4 million just in needed additional special education staff to meet what I believe is the bare minimum of our legal obligation. In addition to that, $500,000 in additional services from speech language pathologists. In addition to that, we're projecting nearly $3 million in additional outplacement services, despite the really broad and deep in-district programs that we offer. The impact is real. I'm proud to say this is my 29th year as a Connecticut educator. This is my 10th year as a school superintendent in Connecticut. This is the budget about which I am worried the most. I've been talking to my board chair and the board for months now. This will be the year, unless we get
30 seconds left.
basically that 11.4% increase, this will be the year that other programs are taken away so that we can support our students who have special needs. The need is real, and I thank you for your consideration to any help and support you can provide for funding for special education. Thank you.
Sorry. How much are you saving in the long run with the, for your in-district placement? How many kids that were out of placement have now been able to be, provided services within the district? And I don't know if you have a sort of a sense of how much that has saved you over, and since you've started that, and when did you start that in-district programming? And are the outplacements up because, as you mentioned, you don't have space? Or is it's just the needs are not able to be met even though you have a robust in-district program? It's both. Thank you. And I see your board chair nodding along. So it's obviously a very critical need. So thank you very much.
Thank you. And Dr. Gaspar, I just wanted to mention that anything that you have that you'd like to send, same thing, especially in regards to, I'd be interested to learn more about the transition program that you have in partnership with the CSU. Perfect. Thank you so much. All right. Next we have Sarah Fennessy, and then on standby I have Mark, is it Couture? Nice. Okay.
Thank you. I'm also the parent of 2 elementary school aged children. My son receives support in school through an IEP and hopes to one day attend a technical high school because of what he has seen. I've been a special education teacher at Prince Tech for 9 years and taught in the magnet school system for 7 years prior to that. In the last 9 years, within the CTEC system, I have witnessed dramatic increases in the number of students with IEPs and also an intensification of student needs. Additionally, similarly to other large cities in Connecticut, we also serve large proportions of low-income students and multilingual learners. As a technical high school, we are charged with producing young adults who will be able to learn and retain technical skills, in addition to developing the reading and math skills that are needed to pass certification exams and earn state certifications in trades such as certified nursing assistant, electrical, or HVAC. We do not receive adequate funding or staff to meet the needs of the students. And it has been my experience that over the past 9 years, we have fewer students who are able to pass their the required certification exams and enter the workforce as licensed trade individuals. As the students' academic and social emotional needs continue to increase in number and intensity, the state should prepare to have fewer certified individuals entering the workforce unless there is an increase of investment and support from our state. CTEC is vital to providing the state with skilled and trained workers, but cannot be successful without additional investment from the state. Additional funding would allow for smaller special education caseload sizes. It would allow for special education teachers to dedicate more time to instruction and less time to completing paperwork and running PPT meetings. Additional funding would also allow for CTEC to look at creative programming in order to meet the increasingly diverse needs of all individuals within the technical high school system. I appreciate the committee's time today, and I'm grateful for the work you all do.
Thank you. I do have a question. If you could stay at the mic for a minute. In the time that you've been at Prince Tech, caseload wise for a special ed teacher, what's been the average from, I guess, when you were there initially to what it is now?
It really depends on the year and if we are fully staffed or not. It's more than doubled, though, from when I started 9 years ago.
Okay. And then in terms of, because a lot of what, we're looking at is retention. In terms of retention, you're one of the teachers we've been able to retain so far, and I hope we're able to continue to retain you. What are things that you think are helpful to really keep our teachers, or what are things that are kind of burdensome and not keeping our teachers?
I think the caseload number has to be addressed. I think potentially looking at, and I did just recently learn there are different forms of certification for special education teachers in other states. Looking at maybe splitting the special education teachers' duties into instruction and then also a caseload management role would be something that would help.
Okay, thank you. All right, Mark Couture, and then on standby, oh, lost my place. Barbara McLean.
Good afternoon. I just want to say first that I support all of the people who've gotten up today. I feel like we're hearing stories about people's genuine experiences, and it's hard to listen to sometimes. I've been an educator here in Connecticut for 32 years, and it's tough to listen to people tell stories about how their children have been impacted and how their family's been impacted without, having some sense of, I don't know what the word is, but without feeling pretty bad about it. Thank you all for having this forum for us. I appreciate you being here and listening to our stories. My name's Mark Couture. I'm a special education teacher at J.M. Wright Technical High School in Stamford, Connecticut. I've been a special educator here for more than 30 years. I'm also a member of the State Vocational Federation of Teachers. We belong to Connecticut for All, a statewide coalition fighting for a better future for everyone in Connecticut. I'm testifying today to ensure the following: that funding increases for our students with special education needs in the state of Connecticut vocational schools, that revisions are made to the educational cost sharing formula to include special education students, that caseload caps are established for special education teachers and related service providers to ensure that special needs students are getting the individualized support that they need. The expansion of the excess cost grant is mandated so that school districts can better support our students with special education needs, and that regulations are created for outplacement centers to prevent skyrocketing tuition increases and takeovers by private equity firms. As a special educator in the state of Connecticut, I've had various perspectives from which I drew my opinion. I worked in public education for over 15 years as both a paraprofessional and a special ed teacher in New Britain, Hartford, and Stamford, Connecticut. I taught inside a prison for the Unified School District No. 1 for almost 15 years, and I currently serve as a special education teacher at Wright Tech in Stamford. In my humble opinion, the state of special education services in each of these school districts I have
30
worked in
seconds left.
has been strained for some time. This is not due to lack of concern or effort on the part of educators or parents. To the contrary, the recent years have brought many new and troubling concerns to the forefront, with little being done other than asking more of educators in general, while providing limited support. In my current position, which I took over mid-year last school year, I was immediately called over
Time is up.
intercom to run a PPT meeting on my very first day of work. My time's up.
Thank you. Thank you so much for your testimony.
Thank you. I just wanted to say thank you, especially I mentioned my mom is a paraprofessional, the work that goes into being in the classroom and the love for the students, just everyone that's here, that's supporting our students. Thank you so much. And thank you for being here and sharing your story.
Thank you.
Okay, next we have Barbara McLean, and then after Barbara, we're going to move back to a few members on Zoom, and then we'll come back to people in person. Just want to remind folks to do the QR code if you're in person and you'd like to speak, and then raise your hand online if you'd like to speak. Thank you.
Good afternoon. Thank you for making special education a priority. I'm speaking today as the proud Director of Pupil Personnel Services for the Canton Public Schools. I'm also speaking as a 20-plus years veteran special educator. I've been in the field my entire career, and I'm incredibly proud of that. And as a member of the Connecticut Council of Administrators for Special Education. I'd like to take this opportunity to address a critical issue impacting our ability to provide necessary services to students with significant disabilities. We need adequate and predictable excess cost reimbursement. This is a key resource to ensuring that we can meet the needs of all of our students. As an educational leader, I often say to my staff, all means all. That means we need to make sure that all of our children have access and that everybody's building the skills that they need to thrive in this world. In 2023, an additional $25 million was allocated to support excess cost reimbursement for the 23-24 and 24-25 school years. With that, the state implemented a three-tiered system, 91% for the lowest wealth districts, 88% for middle, and 85% for the wealthiest districts. In Canton, we have about a 17.9% identification rate and just over 1,500 students. We're incredibly proud of the continuum of supports that we have, being a relatively small district from preschool all the way through transition-based services. Our partnerships with our families are critical. And our special educators, our para-educators, they're the backbone of this work, and they are working hard. They are so tired and dedicated, and I lose sleep at night worrying about the burnout rate of all of the mandates that are placed on them on a daily basis. In Canton, as a middle tier district, we expected to receive 88% reimbursement. However, we ultimately received 62.1%. That's an unexpected shortfall of $371,000. In a small district, that's a big deal. Our budget was already finalized and approved, so that means we now have to look at cutting programs and supports and services in general education to make up this shortfall. It's unacceptable, and we can do better. To address these challenges, I respectfully
30 seconds
advocate,
left.
along with the Concase position, to lower the excess cost threshold from 4.5% to 3.5%, the per pupil expenditure, to support developing and maintaining inclusive programming, and to fully fund excess cost. Thank you for supporting Connecticut students.
Thank you so much. And just a quick question, as a smaller district, we've heard from other districts that at the 4.5% level, you have a difficulty meeting that threshold. Is that the case in Canton as well, that you're not even meeting the threshold for reimbursement in a number of instances because you haven't been able to reach the 4.5?
In some cases, yes,
Times.
especially for our in-district students who are high cost. We have a very difficult time meeting that level of need. And our goal is to keep our students in their communities. So we will bring in supports and services. It's incredibly difficult to meet that threshold. So you're sometimes paying 2.5, 3.5 times the per pupil expenditure rate in Canton. That's just about $22,000. And we're not getting any reimbursement for those students.
No eligibility for those, yes.
Correct.
Great. Thank you so much.
Thank you.
And we're going to shift now to our online. And Kira, you give the next.
Next to speak is Bennett Nakara.
And then who's on deck after that?
On deck is Aloris Guzman.
Great.
Greetings, Representative Khan, Representative Corus, Senator Gadko Wilcox, Senator Castell. Thank you for convening this listening session so we can improve our special education services in our state. I am a school social worker in New Haven at Barnard Environmental Science and Technology School. I've been working for 3 years in this district, but I absolutely love. I'm a resident of Norwich, Connecticut, and I'm also a member of NHFT Local 933. We belong to Connecticut for All, a statewide coalition fighting for a better future for everyone in Connecticut. I am honored and appreciative to testify tonight for increased funding for New Haven public school students with special education needs, increasing pay for all teachers, awareness of the high burnout and turnover among special education staff, and awareness of the dire need to hire and train more special education teachers and support staff to help our students and families achieve a high level of academic and social emotional excellence. Barnard Magnet in New Haven Public School, the K through 8 school, also known as the best. We strive to be healthy and the best for our students, our teachers, and our family. Barnard mission as an urban public school to create a climate that fosters a sense of safety and positive health. It is imperative that our school community build positive relationships and school connectedness with all stakeholders in the community. Our families are the foundation of our school. As an environmental school, our staff strive to teach and reinforce important healthy living skills such as living a healthy lifestyle, emotional awareness, empathy, managing stress, coping with challenges, supportive relationships, perspective taking, setting goals, and creating responsible lifelong citizens of New Haven and our world. Furthermore, I want to talk about how critical my role is as a school social worker to my students and families. Many of my students are afraid to come to school for fear of having their families separated. Schools are and should be a place for safety, privacy, kindness, and compassion for our families. Our families are wonderful community members, people that care about my school and their children, and it's disheartening to see my family worried about their immigration status or if they belong. I wanted to say to my lawmakers that my students and family do belong. They are so valued, and I'm appreciative of their dedication to helping my students learn and grow toward a better future. My family show me every day in many different ways that they are brave and determined to overcome obstacles, which is ultimately what special education is about. Special education and making a difference in the most vulnerable population is at the heart of why I am a school social worker. As someone who is hard of hearing, I wouldn't be here today without all my teachers and language, speech and language therapist. I am grateful. One of the most important parts of my school social work role is meeting with the parents. Parents should not have to worry about their IEP need being met or worry if their children are safe or respectful of their privacy. I wanted to ensure that to the lawmakers that their children's IEPs will be
Time
met.
is up.
New Haven Public Schools will be safe. Thank you.
Thank you so much. And thank you for all that you're doing to support students as well.
And next to speak with will be Aloris Guzman, and following will be Isabel Rivera.
Hi.
So Isabel, look, I don't see Dolores. So what we'll go to Isabel, and if Dolores is there, we'll come back.
Sí. Mm, ok.
Oralis, usted puede darlo,
Hello.
puede leerlo y después lo leeré yo en inglés y siga usted y después vamos con, perdón, Isabel, usted léalo.
Ok. Sí. ¿Me escucha?
Sí,
Hola.
hola, soy Oralis.
Ok, léalo por favor, Oralis.
Ok, muy buenas tardes, saludos representantes, Ken, representante Couras y senador Gascar Wilcox y senador Vicel. Gracias por convocar esta sesión de escucha para que podamos mejorar los servicios de educación especial en nuestro estado. Mi nombre es Oralis Guzmán, soy miembro del colectivo de defensa y coalición Conérico para Todos. Mi hijo es estudiante en una escuela pública de Hartford y fue diagnosticado con déficit de atención e hiperactividad cuando él tenía 7 años. Su pediatra recomendó que le hicieran una evaluación, la cual en ese momento no se le pudo hacer en la escuela que estaba en ese entonces, porque no había personal, no había ni una psicóloga ni una trabajadora social en ese momento. Entonces todo quedó sin resolver. Después su pediatra lo recomendó a una terapista, la cual recomendó que mi hijo recibiera una ayuda en su escuela actual, pero no está recibiendo la ayuda que él necesita porque sigue teniendo problemas con su aprendizaje. Ya he tenido en este año 2 reuniones del PPT. En la primera me dijeron que sí calificaba para cierto apoyo dentro de la escuela y se hizo un plan que solo funcionó la primera semana. Por eso pedí una revisión ya que no estaba funcionando. Yo necesitaba una evaluación general que incluyera todo en su nivel académico. Atendieron mi petición, pero en la reunión me dijeron que no aplicaba para educación especial, solo porque él estaba encima de un nivel que ellos tienen. Como madre conozco a mi hijo y veo que él necesita la ayuda. Veo esa frustración en su aprendizaje y me siento muy mal por no poder ayudarlo. Ahora le están dando tutoría 2 días por semana, lo cual es muy poco por todo el atraso académico que mi hijo tiene. En la escuela me dijeron que no contaban con mucho personal porque tuvieron muchos despidos y que iban a hacer lo que pudieran con los pocos recursos que tiene la escuela. Necesitamos que contraten más personal para ayudar a nuestros maestros. No están, porque están haciendo despidos de maestros que tienen mucha experiencia en el asunto. Y pues, ¿verdad? Y que les paguen un salario justo para que puedan atender las necesidades de aprendizaje de nuestros hijos. La falta de personal en las escuelas afecta el aprendizaje como le está afectando ahora mismo a mi hijo. Muchas gracias por su atención.
And I'll be doing the translation. Greetings, Representative Ken, Representative Kuras, Senator Gargar Wilcox, and Senator Kisel. Thank you for convening this listening session so we can improve special education services in our state. My name is Oralis Guzman. I'm a member of the Hartford Deportation Defense and the Connecticut for All Coalition. My son is a student in Hartford Public Schools and was diagnosed with ADHD. When he was 7 years old, his pediatrician recommended that he should get an evaluation, which at the time could not be done at the school because there was no staff. So everything was left unresolved. Then his pediatrician referred him to a therapist who recommended that my son get some help at his current school, but he is not getting the help he needs because he continues to have problems with his learning. I have already had 2 PPTs meetings with the school this year. At the first one, I was told that he did qualify for some in-school support, and a plan was made that only worked for the first week. So I asked for a review as if it was not working. I did an overall evaluation that included everything in his academic development. They granted my request, but at the meeting, they told me that he did not qualify for special education support because he is above a level that they set. As a mother, I know my son and I see that he needs help. I see his frustration in his learning, and I feel bad that I can't help him. Now they are tutoring him 2 days a week, which is very little for all the academic delay my son has. At the school, they told me that they didn't have enough staff because they had a lot of layoffs and they were going to do what they could with the few resources the school has. We need them to hire more staff to help the teachers. Don't lay off experienced teachers and pay them a fair salary so that they can meet the learning needs of our children. Understaffing in schools affects learning as it has happened to my son. Thank you.
Thank you so much for that important testimony.
Next to speak will be Isabella Rivera.
Isabel, ¿usted es la siguiente en hablar?
Sí. Hola, buenas tardes. Mi nombre es Isabel Rivera y tengo un hijo en el 6º grado en la escuela aquí en Hartford. Soy miembro del colectivo de deportaciones aquí en Connecticut para todos. Mi hijo ahora recibe servicios de educación especial por su retraso académico, aunque está en 6º grado. Por su edad, hace lecciones del 4º y 5º grado. Hay una sola maestra en su clase que tiene entre 25 y 30 estudiantes, mientras que antes había otra maestra para ayudar. Hay una sola maestra de educación especial por toda la escuela. Quiere decir que ella nunca puede ayudar a un solo estudiante más de 1 hora por semana porque tiene tantos estudiantes que tiene que apoyar. Los legisladores deben de ponerse a pensar en la situación que los maestros están pasando ahora mismo en las escuelas públicas de Hartford. Hay que tener en cuenta este grave problema de la deficiencia de maestros y personal. Como madre tengo mucha simpatía por los maestros. Me ha dado la oportunidad de visitar las clases de mi hijo y ponerme en el lugar de las maestras. Es bien difícil tener 2 o 3 hijos en casa. Entonces, imagínense pónganse en el lugar de las maestras con 30 niños en cada salón y no tener ayuda de nadie mientras que están enseñando. Además, los niños de educación especial de varias condiciones necesitan varios apoyos específicos y un ambiente tranquilo para enfocarse y aprender como lo puede lograr una sola maestra. La deficiencia de maestros que hay ahora mismo viene arrastrándose desde hace muchos años. No es solamente en este año, sino que ahora fue que se explotó lleno el vaso de agua y ahora podemos darnos cuenta de este problema que lleva tantos años. Entonces, este problema de retraso académico que enfrenta mi hijo no viene de un año, viene desde sus 11 años. Hace 11 años hay muchas investigaciones sobre la educación y
30
la
seconds
educación
left.
especial. Sabemos que ok.
Menos de 30 segundos.
Ok, yo recomiendo a nuestros legisladores pagar un salario justo para que se queden los maestros con experiencia que ya tenemos, contratar más maestros y darles toda la entrenamiento y apoyo profesional que necesitan para hacer su trabajo. Las condiciones laborales de nuestros maestros son las educación,
Time
son
is
las
up.
educativas de nuestros hijos.
Good afternoon, Representative Cam, Representative Corraz, Senator Gatkar Wilcox, and Senator Kisal. Thank you for coming in and listening session so we can improve the special education services in our state. My name is Isabel Rivera, and I have a son in 6th grade at Breakthrough Magnet School in Hartford. I'm a member of the Hartford Deportation Defense and Connecticut for All Coalition. My son currently receives special education services for his academic delays. Although he is in 6th grade, according to his age, he is doing coursework of the 4th and 5th grade levels. There is only one teacher for his class of 25 to 30 students, while before there was a second teacher in the classroom to help. There is also only one lone special education teacher for the entire school. She can only spend an hour per week with each special education student because she has so many students she has to support. Our legislators must seriously consider the situation that our teachers find themselves in, and this moment, in Hartford Public Schools, we have to focus on this great problem posed by the teachers and personal shortages in our schools. As a mother, I have a lot of sympathy for teachers. I have had the opportunity to visit my class, the class of my son, and put myself in the place of the teachers. It's pretty difficult to have 2 or 3 children at home, so I can't imagine myself in the place of a teacher who is in charge of a class of 30 and doesn't have the help for anyone while trying to do her job as a teacher. On top of that, special education students with various conditions need a variety of specific supports and calm environment in which to focus and learn. How can one teacher achieve that? I recommend to our legislators pay a just salary so that teachers with experience to stay in our
Seconds left.
schools. Hire more teachers and give all teachers the trainings and the professional support that they need to do their work. The work conditions of our teachers and the education conditions of our students. Thank you.
Thank you so much. And thank you to you both for the advocacy that you're doing as part of the coalition. And I think we're moving on back to in person. And just as a reminder for people who have joined, if you want to join on Zoom, you can raise your hand. And then for those in person, I think you already have signed up with using the QR code. Go directly to the clerk. And next we have.
Okay. Next, Esther. I think Esther's in person. Yes.
Good afternoon. Thank you for the opportunity to give testimony on the crisis of funding and staffing for special education in Connecticut. My name is Esther Jiboyu, and I'm a constituent of West Hartford. I am also the mother of a 7-year-old autistic son named August. He is a kind boy with an amazing sense of humor. His favorite joke is always a knock-knock joke, and why did the chicken cross the road? August loves to draw, create comic books. His favorite author is Dave Pilkey, creator of The Dog Man. He loves snacks and still believes in the Tooth Fairy. He takes pride in his honesty and will tell you if he has done something wrong. He has a love of life, but August hates school. He says his brain is different than everybody else's, and why is everything so hard for him? His fingernails are sore from biting them when he's anxious. He says he gets nervous when he has to work alone in school. He was diagnosed with autism in 2019 and then with ADHD in 2022. Since he was 18 months old, the goal has been improving his ability to learn. Unable to continue to work and ensure he will receive maximum amount of therapy recommended, we face bankruptcy and the risk of homelessness. Choosing his educational needs over financial gain has been a reoccurring issue every day since his diagnosis. He is now in the 2nd grade, and he is still performing behind academically. Most of my son's education is left to a paraprofessional, which is unacceptable for me. I appreciate the challenging work that paras do every day, but paras are not trained and certified the way teachers are. He deserves to be educated by a fully certified teacher who has a master's degree in special education. His para is the 5th para to assist him since he has been in school. He has had to adjust to 3 different special ed teachers in this year alone. With every new adjustment, his progress is pushed back significantly. Autistic children require consistency for them to process and retain information. The funding that is needed to staff special education programs with certified teachers and students need continues to be the root of the problem. Out of 7.5 million special educated students in the US, nearly 88,000 of them
30 seconds left.
Are in Connecticut, which is approximately 17.1% of Connecticut's public school students. The most common disability for special education is learning disabilities. Students with learning disabilities on average perform 2.6 years behind typical peers. We are all here today in the attendance of the Hartford Legislative Building in the 2nd richest state in the United States. I'm asking today for your generosity in funding for special education programs. The quality of education
Time is up.
The quality of education our special needs students receive today enhance their level of productivity in the future. It will cost the state more to provide for adults that cannot provide for themselves than it will to invest in our special education programs. I am grateful for your time and thoughtful consideration.
Esther, thank you. I just have a quick question. You said your child having 3 teachers, is that in one program?
1 year.
But is that in the same program?
In the same program.
So the same.
He's had 2 teachers quit abruptly. Last year, he had 2 paras quit abruptly. And of course, it has to be because they're overwhelmed and understaffed. The paras are left to educate him, which they are great with him. They give him a safe place, but unfortunately, they are not qualified to teach him. They suspect him with dyslexia or possibly dyscalculia. We won't know that for the next year or 2. And unfortunately, I'm home from work to assure that I am present at home to provide him with the education he needs at home, because there's 2 education special children need. It's at home and it's at school. I am present. We read at night, we do math together. Unfortunately, in school, the teachers are overwhelmed. It has become a tight situation between me and the school. I am grateful for the opportunity to hear all the teachers speak today because it gives me a perspective, and perspective is important in all situations. I am so dedicated to the ability for my son to learn. And it's crucial. I have a brother, and this is not related, but it is perspective. I have a brother. He is 43 years old. He is an unproductive citizen of society. He was misdiagnosed all years of his life. He has become a reoccurring criminal. He does not produce anything to the state, okay? If he was diagnosed, if he was taught properly, he would have had a better chance of being a productive citizen. It starts in elementary school. There was another representative here speaking about 14 to 22, which is crucial. But the brain is soaking in everything between 8 and younger. If we miss that gap, most of the children don't have a chance. Most of these children struggle socially, and that'll be a struggle they'll have long past school time. So it is important. It's important that we invest in our children. you won't have to take care of more of them as adults. And I think that's important perspective to think about when you're thinking about financial cost and what you invest in.
Absolutely. Thank you so much
Thank
for
you.
your testimony.
I gotta go, but I thank you for who is here. I appreciate everybody.
Thank you. Next, we have Jennifer Graves, and on standby, Police McCarthy. I just want to remind folks to sign up if they have not to speak, using the QR code that we have in person, or raise their hand on Zoom, and we will get back to people on Zoom, once, a few more folks in person have testified. Thank you, Jennifer.
Good afternoon. Thank you for convening this listening session so we can improve our special education services in our state. My name is Jenny Graves. I am a pre-K special education teacher in New Haven Public Schools. This is my 15th year teaching. I am a North Haven resident and a public school parent of a child with an IEP. I am a member of American Federation of Teachers National Special Education Cadre and the Vice President of New Haven Federation of Teachers. We belong to Connecticut for All, a statewide coalition fighting for a better future for everyone in Connecticut. I am testifying today to ensure that House Bill 5001 contains more funding for special education, equitable education experiences statewide, and caseload and workload regulations for special education teachers and related service providers. Last year in New Haven Public Schools, our district hired 33 new special education teachers. By the end of the year in June, we had 30 special education teachers leave their positions. We gained 5 social workers, but lost 8. We gained 2 school psychologists, but lost 3. We gained 1 speech pathologist, but lost 2. We have a retention crisis in New Haven, and it's due to incredibly high demands, workloads, and caseloads being placed on the professionals who are servicing our most vulnerable students. There are no defined work rules for a special education teacher. We have become evaluators, case managers. We run our own PPTs, we write IEPs, and there's an ever-growing list of responsibilities that take away time from actually instructing students. There are no limits to how many students that we can service. We have self-contained classrooms with up to 18 students with very complex needs. We have speech pathologists that have 80 to 100 students that they have to meet weekly in 5 different buildings. Students are not getting the individualized interventions as outlined in their IEPs or the resources that they deserve to succeed. The burnout and frustration are palpable in our schools, and our educators are not only leaving our city, but leaving the profession. No educator wants to be ineffective to their students, especially when our students are paying the price of a broken system. Workload and caseload regulations would transform the working conditions of our professionals and learning conditions of our students. In the richest state in the richest country in the world, it is disgraceful that intervention opportunities are dependent on zip codes. My son, a high school sophomore with an IEP, attended New Haven Public Schools through the 5th grade. Despite dedicated educators, the limited resources, large caseloads, and insufficient training widened his achievement gap. Even though his school wanted him to succeed, they could not afford to do more. I'll just finish real quickly. When we transferred to our home district in North Haven, he gained access to specialized programs and smaller classes that transformed his school experience. And what that demonstrates is that wealthy towns with a high tax base can better serve students than urban districts, creating a racial injustice in special education. The stark disparity between these 2 districts, just 10 minutes apart, is unacceptable and highlights the needs for systematic change. That is my time, but thank you very much.
Thank you. Thank you, Jennifer. All right, next we have Patrice McCarthy on standby of Gail Nolan. Thank you.
Good afternoon, distinguished members of the Select Committee. I'm Patrice McCarthy, the Executive Director and General Counsel for the Connecticut Association of Boards of Education. I commend you for your attention to these very important issues. I had the opportunity to represent school boards on the Special Education Task Force, and I chaired the Finance Subcommittee of that group. It was a very diverse representation with many viewpoints that were represented, and I fully support the consensus recommendations that we came to. Today, you've heard testimony from the superintendents in Hartford, Meriden, New Britain, and Southington, as well as district staff from other school districts. The concerns you heard from them represent the concerns shared by all boards of education. We have legislative breakfasts. We've seen many of you at them around the state, and as well as monthly board chair check-ins. And consistently, the primary issue that is being raised is concerns over special education. The first priority for boards of education is to remove the cap on the special ed excess cost grant. When districts found out several weeks ago, well into this budget year, that they would only be receiving reimbursement of between 59 and 64% of what they were eligible for, that was devastating to local budgets. That excess cost grant was designed as a safety net for school districts. It is now full of holes. There is no certainty that is being provided to districts. In addition, you heard testimony about the costs that don't meet the threshold for which there is no real state contribution. We urge you to include a weight in the ECS formula so that the state would share in those costs where districts are working very hard to provide services in their district. Better for the students, as you heard, less transportation costs, and a more meaningful educational experience where they can be educated with their typical peers and participate in other community activities. The continuum of services is also critical, and the proposal to include resources to allow districts or regional service centers to expand program development and maintain those programs.
30 seconds left.
So that we have fewer students in private out-of-district placements. These issues have been discussed for decades. The commitment of the 1,400 volunteer school board members to meet the needs of all students remains strong. We are optimistic that the focus of this select committee will yield positive changes in this legislative session, and we thank you for your dedication to all students.
Thank you.
And I just wanted to say thank you so much for your work on the task force. Those recommendations were so thoughtful and informative and comprehensive and will be a tremendous asset for this committee. So thank you very much for your contributions.
You're welcome.
And we have one question.
Thank you, Madam Chair. Thank you for your testimony. I did read the task force's report, and as between the dropping the threshold for the excess cost grant below 4.5, and I know the task force recommended dropping it to 3 on in-district placements, or adding special education to the ECS formula, is that just a matter of the math? Because if we took all the numbers and we ran the numbers, we could figure out where the state is putting in more money.
Right.
But other than that, is there a preference to how the state delivers that funding to the district?
I don't think the task force came up with a preference. No, they identified both of those as issues.
So 6 of one, half a dozen of the other.
Yeah.
It's just a matter of the state putting in more.
The first priority from the perspective of boards of education is clearly the cap on the excess cost grant. That impacts everyone because it means there is no certainty as to what they'll be reimbursed. And they find out in late January of the current budget year.
Meaning the shortfall.
Exactly.
Okay, thank you.
Okay, thank you. Yes, next we have Gail Nolan, and then after Gail, on standby, Patricia Sullivan.
Hi, excuse me. I'm Gail Nolan. I'm the current president of the Connecticut Family Resource Center Alliance. Family Resource Centers already help with special education in Connecticut by seeing families early and getting them connected to services as early as possible. We have 57 family resource centers in 40 districts in Connecticut, down from our high point of 84. I'm also the director of the Laurel Family Resource Center in Bloomfield, which is a part of the pre-K to second grade school. In Bloomfield, we're a community that works closely together to pool resources and responsibilities to do our best for families. The FRC is important in our community. We have home visiting using parents as teachers, host play groups, parent trainings, run a diaper bank, clothing closet, and most important in this testimony, do screenings for children. We make referrals to various programs like Birth to 3, more intense home visiting programs if there's a high need. We work with state programs to help families get what they need, like food, fuel assistance. We connect families to the basic human needs and education services, and we work to avoid duplication in our communities. We work starting with families prenatally if they desire, and making sure they have what they need to welcome a child into their home. This early intervention and screening helps family get the important start they need, because as you know, early detection and intervention are in education are critical when looking at all families, and especially those with special needs. We work with home daycare providers to do screenings. We work with preschools in our community, and communicate, collaborate with the libraries, social services, health services in our own communities. We're funded by the State Department of Education and have our own line item, but this year in the governor's budget, our line is zeroed out. And we are combined with other support services such as after-school grants, youth centers, parent trust funds, school-based diversion. And we're worried that this cut in programming will detrimentally affect our early intervention services. We have been in Connecticut since 1988.
30 seconds left.
And have a long reputation of making a difference in Connecticut. So we just want you to be aware of that as you're looking. It's kind of another cut to special education.
Thank you, Gail. All right. The next person I have was Patricia Sullivan. I'm not sure Patricia's still in the building. No. Okay. All right. After that, I have Ajay Shah. And then on standby, well, actually, then we'll move on to Zoom. We have Nicole on Zoom. So is Ajay? Okay. All right. So we will move on to Zoom. We'll start with Nicole. And then on standby, we have Annie Sterna. Just a reminder for folks on Zoom to please raise your hand on using the Zoom feature so that we can promote you as a panelist to speak. Nicole.
Hello, can everyone hear me?
Yes, we can hear you. Thank you.
Thank you. I apologize for that. Sorry I had to leave. I had to go pick up my child from daycare, but I want to say my name is Nicole Porter. I am a parent representing my child and children like my baby, who is an elementary student that attends Hartford Public Schools. My child has received services from birth to 3 and transitioned to receive services from pre-K 3 and is still in need of more services. I am really pleased that your committee is providing this platform for stakeholders to speak about this very important topic. And I think that it's very polarizing. No matter where you are on the party lines, we can all agree that we need to do more for our children who have special needs. You'll hear me say my child to protect my baby, because the world is not kind right now. And my country is not kind, especially to children with special needs. I definitely appreciated the recommendations put forth by the task force and the budget recommendations by Governor Lamont. I just fear that the funding is not enough. And we are not looking at things holistically for SPED students. And we need to look at things from a place of equity. And I think we do need to make more recommendations. And I would like to use this opportunity to share my child's experiences to help bring about more recommendations. As some parents mentioned today, early intervention is really key. At 6 months, after 6 months of birth to 3 services had ended for my child, I was left to figure this thing out on my own. This landscape of special needs education, I Googled, I joined mommy blogs on Instagram, I clinged to parents who were dealing with the same diagnosis as my child. I read through the documents I received during PPT and asked teachers I trusted or who otherwise felt sorry for me. I even signed up for my child to receive services through DDS, and they are on the wait list. We need to fix that. Why is this the case? Is the thought process that the school districts will have them and provide for them? Because they don't. And it's not for lack of trying. You've heard from leadership from Hartford, from teachers, and what they're facing from staffing to transportation issues. The fact that my child attends school and does not get all of the services that they need should not be the case. I've had to advocate tooth and nail for what my child has now. I'm sorry, I know my time is up, but I need to finish.
That's okay. You can finish your thoughts. Go ahead, Nicole.
Thank you. I am trying to drive and hold it together. Thank you for being so understanding. So parents like me are frustrated. They're angry. They're doing what we can. There was another mother, her name is Esther. She echoed many of the things that I felt and wanted to say. I am experiencing some of the same things with my child. My child receives one-to-one services, and without my child's para, they would not be thriving as much as they are now. Paras need to be supported, as do our teachers. Earlier, I mentioned holistically, looking at things holistically and looking at things from a lens of equity. The fact that my child attends school in Hartford tells you that they need more support. While I do support the opportunity to provide more funding for special needs for special needs students, there needs to be a deeper look as to how we're going to support special needs in large districts like Hartford. They should not have to go without. I shared my child's birth to 3 experiences, but beyond that, I'm thinking about their experience in school. Are they receiving the same type of social experiences as their typical peers? For my child, no. My child spends their after school hours getting therapy that he should be receiving in school. Every day from 3:30 to 7:30, I hire a therapist to accompany them so that they can be part of an after school program and have an experience like typical peers. We then transition those services to home so that my child can receive tutoring. And this comes at a cost. As a single parent, it's tough financially, but parents should not have to bear this financial burden. I have to think about my child's future and doing my best to ensure that they have the skills that's needed so that they can be a productive member of society. I always think about, when my eyes close, can my child support themselves? How will they support themselves? That being said, learning does not stop. It does not stop after high school. Parents need more supports, independent supports, to help guide their children from birth and beyond high school. I wish I could say more. I am driving. I want to keep safe, but thank you for this committee. Thank you to the task force. Thank you to all of the parents that have said something today in speaking up for children with special needs. Thank you.
Thank you. Thank you so much, Nicole. All right, next we have Annie Sterna. I don't have anyone else online with their hand raised, so I don't have anyone else in standby, but if I see many attendees, so if folks online do want to speak, please make sure you raise your hand using the Zoom feature. Thank you. Annie.
Hi, my name is Annie Sterna, and I'm from a small district. It's RSD 17, Haddam Killingworth. We have about 1,700 students between both towns. I'm on the Board of Finance, so I work closely with the Board of Ed to help pass the budget. And I'm also the grandparent of a child with autism and cerebral palsy. He's in second grade. Here he is, if you can see his picture. I guess it's too blurry, but he's doing well. And however, we do have issues with teacher retention over the summer. The special ed teacher and 3 paras left to go to a cooperative, and that left the children going into the school year with a brand new teacher who only lasted 30 days before she left without notice. We then had a 3-month period without a special ed teacher, which, as everyone has said already on this call, these kids need structure and stability. So often the children are kind of thrown into a tailspin when they don't have a teacher. Financially, the issues I think have been covered here as well. The paras do a great job. Often they're one-on-one with the students, but they need to be paid a living wage. Most of them are certified, and we frequently lose them to other usually it's to cooperatives or other places where they're being paid more than the district can pay them. And I don't know how much of that has to do with union contracts and all of that, but it becomes very difficult to get people to stay. We do have an issue with all teacher retention, but I think the major issue is with the special ed teachers. We have some great OT, PT, and speech teachers. Mostly they are they're brought in as contractors. We also
30 seconds left.
we also have to share with other towns because they're just not available for the district. So I guess I just want to say that the excess cost, we don't get reimbursed even the amount that we're supposed to. And we don't know about it until halfway through the year. So I just think this is a great committee. I followed the task force and this committee, and I really believe that we can get some help for the special education programs in all towns, including the tiny towns who need it just as much as the big cities. Thank you.
Thank you, Annie. Did you say, and I just want to go back to what town did you say?
I live in Killingworth, but the towns for RSD 17 are Haddam and Killingworth. We have 900 students, and there's 1,700 total.
Okay. And then when you spoke about shared, like related service providers, do you mean within the region, or do you also mean like outside of the school district?
Outside of the district, I believe one of the either PT or OTs are subcontracted, and we share them with, I believe, Clinton. So, we have a case where they're not only going back and forth between different schools, but they're also going back and forth between different school districts.
Okay. All right. I think we have a couple more questions.
Yeah, have you been able to reach the eligibility threshold for the excess cost reimbursement, given that you're a small district?
That I don't believe I can answer that. I'm thinking no, because that was a point of discussion at the last Board of Ed meeting I went to.
Okay, that's what I thought. Yeah, we heard that from small districts. We'll check. We'll follow up with the district, but that's one of the problems for smaller districts. So thank you.
Exactly.
All right. Thank you so much, Annie.
Mm-hmm.
All right, I see a Heather Sansone with her hand up. Heather, you may speak, and then again, if folks online want to raise their hand, so we can promote to speaker. Thank you.
Oh my goodness. Can you hear me? Sorry.
Yes.
Okay. Apologies. Hello, my name is Heather Sansone. I'm a parent from West Hartford, and I was not planning to speak today, but um, I find myself in a really unique position where I'm straddling being a parent of a child who's on an IEP against being a parent in a town where we're being told that our school district is staring down a nearly $3.8 million deficit for the coming year. And it all sort of ties into the special education costs that are clearly more than any of these towns can sustain. I have concerns mainly because my son is up for his triennial review this year, and knowing that he's fortunate for being maybe a little bit higher functioning, if you will, if that's a term, able to be in the mainstream classroom, largely still needing support, not quite meeting grade level expectations in some areas. But I'm scared that I'm going to have to make a case for why he should still even get support because we are staring down a really large deficit. So I just think that it's clear that we have to go beyond our town Board of Ed. I've been to the Board of Ed several years in a row. We've all been talking about these very big issues with funding. And it's clear it needs to go beyond what our town is capable of doing and also where their responsibility and limitations of power are, which is where you guys come in. And I'm grateful that the conversation has been opened for people like myself to just jump on from my bedroom in West Hartford to talk to you all and just to say that clearly the funding structure needs adjusting. If our town is not able to be reimbursed anywhere near what they were expecting, it's going to have a devastating cost, and it's not just going to be on the special education front. I don't know where my town's going to find nearly $3.5 million to not have to have drastic cuts on already overstretched staff in a lot of areas. Guidance counselors in particular have had to pick up a lot of slack amongst many schools, and it's only going to get worse. So I just hope that this entire day of testimony is compelling enough to see where the funding structure can change. Thank you for your time.
Thank you. Thank you, Heather. All right. I see no more hands raised on Zoom, and I have not seen new people enter the room. So if there is anyone else on Zoom that would like to make a comment, please raise your hand. I'll go 1, 2, 3. Okay. All right. And so I think we're going to conclude for today. I will also just like to mention we did have on the agenda for today's listening session, there was a link, and there's been links in previous agendas as well, to send a written public comment, which would then be sent to the entirety of our committee. You also could just also email one of the chairs, and we will forward that on to the rest of the committee. All of those would be read by members of our committee to help inform, of course, the work we're doing. And then once we have a draft bill, we would have a public hearing. So for folks that have spoken at any of our listening sessions, stay tuned for the date for our public hearing as well. So I want to thank folks that did come to speak in person, and if you stayed online on Zoom, thank you for providing your testimony. Especially, I know it's incredibly difficult as parents to provide some of the testimony. It's obviously very emotional testimonies that we've heard. And it's also not easy for teachers to come in right after a long school day and provide testimony and talk about really wanting to provide what we would love to provide to all students, our best, experience possible, but without the means to do it, unfortunately, is not currently happening. So I just want to thank those that did come to speak. And like I said, that please just look forward to our public hearing that will come up going forward. In the 2-3 minutes that I was talking, I do see one more hand. I will recognize this person and then allow my co-chairs to offer some closing comments. So Mariuri Coelho. Hi, Mary, you are promoted. I see you on the other part. I think you are now a panelist, so you just have to unmute and you are welcome to speak.
Hola.
Hola, I think we would need the assistance of the interpreter, so if you can come speak and then
Hola, buenas tardes.
Hi, good afternoon.
Hola, buenas tardes. Soy Marjorie Coello, la mamá de Alexa Milagro Juárez, una niña con discapacidad, parálisis cerebral, una niña que no se puede movilizar sola. Tengo que ayudarla. Ella no puede ir al baño. Ella no puede comer sola. Ella no puede hacer nada si no es con la ayuda mía. Entonces, yo quería pedir que hayan fondos también para la escuela, para ellos, cuando ellos necesitan, ya que ellos son unos niños con mucha discapacidad. El año pasado ella no comía, dejé de mandarla a la escuela, porque primero tuvo una cirugía ella la operaron de trombosis y luego ella estuvo en casa, luego yo la mandaba en la escuela, ella no quería comer, ella venía con peso normal y cuando ella está viendo a la escuela, ella me bajó de peso. Entonces yo casi no la mandaba porque la maestra que estaba el año pasado era muy mala, porque como que ella no había algo en ella para motivarlo, la niña. Y siempre la niña, así como yo mandaba la comida, siempre así la traía. Pero este año la maestra que llegó nueva, estamos alegres porque ella ha aumentado de peso. Es una maestra muy puntual, ella todo lo que pasa con Alexa, ella me está mandando a decir que cómo va Alexa. Lo único que yo pedí ayuda sobre ella, como en la economía, para decirle que cómo haría para que a ella me le dieran como que me le devolvieran los cupones, pero no he tenido respuesta de nada. Y bueno, que haya una ayuda para nosotros, así para ellos, con las
30
condiciones de
seconds
ellos.
left.
¿Hola?
Tiene
Sí.
30 segundos.
Entonces, eso estamos pidiendo, ¿verdad? Que nos ayuden así como nosotros necesitamos con las personas con discapacidad. Así en la escuela que hayan más fondos para ellos y que nos puedan resolver el problema.
Time is up.
My name is Mario Coelho Flores. I'm a member of Hartford Deportation Defense and a Connecticut for All Coalition. I have a 9-year-old girl with a disability. She has a cerebral palsy and her name is Alexa Milagros. We're from Honduras and I live in Meriden. My girl studies in a school in Meriden called Israel Putnam. Our experience at the school has not been easy. My daughter was not eating and lost weight. She needed to be fed and they didn't feed her. This year she got a teacher with more patience and my daughter has started to gain weight. My daughter needs special care at all times, and that means that I can't work because she can't walk, go to the bathroom, or eat by herself. Because of her condition, she is very dependent on our care. That is why I want to ask you to increase funding for our children with special needs so that schools can provide the services and our children can succeed. It would also help me if the school could connect me with the resources that could help my children's care. Thank you.
Sí.
Thank you.
Thank you.
Si esto era todo lo
No,
mío.
sí, ya terminó. Perdón, sí.
Okay. Okay, gracias.
Gracias.
Bye bye.
Gracias, thank you.
Okay.
All right, so with that, I'd like to offer, if my co-chairs, and I know Representative Corpus, you joined in the middle of the meeting, you didn't get to give especially opening comments, so absolutely, please want to give you that opportunity.
Just a very big thank you to everybody who came today. It was a day of many hearings at the Capitol, so I look forward to watching the entire hearing on CTN. This today concludes our listening sessions from the public other than the public hearing. As Chair Khan mentioned, it's been a very, very fruitful for listening tours, and it wouldn't have been if people hadn't been willing to come forth with their experiences and their testimony. So just a very big thank you.
And let me echo that as well to conclude our listening tours here. It has been really, really important for us to be in the community, not only to be in the community, but to see how much the community comes together to provide support for speakers for around these issues. The amount of consensus there is in the community across sectors, across sort of individuals, whether superintendents, boards of education, parents, teachers, advocates, there really is a lot of consensus that more needs to be done. And we have a moral obligation to do better. We've heard you, we're listening, we're going to push for what we can. We see some real needs here. But just thank you again, just to echo what, my good colleagues have said for this. I just really appreciate the time people have taken to come out and to share. It's not always easy to do that, so very, very much appreciate it. And I think it's been really helpful for us, and we hope gave you an opportunity to be heard as well. Thank you.
Representative Poulos.
I'd just like to say that as a parent, as a teacher, it has been really great to hear testimony from people like me, parents and teachers. And we've heard a lot of things. I think certain trends are coming together on where we might go with this. And so I look forward to distilling all of the testimony, whether it was written or presented online or in person, and moving forward with this good work. And we will have a public hearing when we have some draft language together and hear more. So thank you for your engagement, and I look forward to continuing the good work.
All right, I think we have a hand that did just go up. Fiorella, if you want to make a comment, you can. I think we'd have to promote to panels. Okay, I'm not sure if that was an accident.
She's rejoining as a panelist.
Oh, okay, all right.
Fiorella, you need to unmute yourself, please.
Hello?
Hi, we can hear you.
Okay. I speak not too good the English. It is possible have interpreter?
For what language?
Spanish?
Spanish, yes.
Okay.
You can start.
Okay. Buenas tardes. Mi nombre es Fiorella Sandoval. Me gustaría dar mi experiencia. Voy a tratar de resumir lo más que pueda, que mi experiencia ha sido muy larga. Tengo un niño de 13 años que va a la escuela de Hartford, a la escuela pública de Hartford, y pues lamentablemente pues hemos tenido muchas malas experiencias, casi 6 años luchando para mover a mi niño en una escuela pues apropiada, ya que vemos un potencial en el área pues académica de él. Yo entiendo que las profesoras dan su mejor esfuerzo, pero como les explico en cada PPT, siento como que él necesita otra cosa. Entonces, pedí un IEE, algo así se llama, una evaluación independiente de académico, y me la negaron. Con todo mi esfuerzo y ayuda de mi familia, pude recolectar el dinero para poder conseguir un neuropsicólogo y le hagan esa evaluación, que iba a ser mi evidencia para yo poder mover a mi hijo a un lugar donde el ambiente sea bueno para que él aprenda. Porque yo sé que él es un niño muy inteligente, simplemente en una clase de 30 niños, él no se concentra o no aprende. Y sigo peleando con eso. Me gustaría que escucharan mi voz y que tomaran en cuenta de que estos niños pueden salir, son capaces de tener más que aprender una suma y una resta, son capaces de llegar a ser profesionales. Yo creo en mi hijo, confío en mi hijo y sé que él lo puede hacer. ¿Y quién más como yo para ayudarlo? Soy su support, soy su voz, soy sus ojos, soy su oído y no quiero dejar de pelear por sus derechos al margen de sus necesidades especiales. Creo que mi hijo, no lo he mencionado, mi hijo es un niño autista que nunca tuvo problemas de comportamiento. Y por favor, que se escuche la voz de todas esas personas que están dando su testimonio. Creo que deberían mejorar
30
mucho en
seconds
el
left.
para terminar, solo les diría es que deberían mejorar más en el área de educación especial, que estos niños lo merecen. Gracias.
All right, real quick over here. Her name is Fiorella Sandoval. Her experience is with her 13-year-old son at Harvard school system. She had a very bad experience for the past 6 years or so. Her kid has a lot of potential. There is a lot of teachers that had tried, but he needs something else. She had to request a specific evaluation. She mentioned it like ITT or something like that. Not sure which one is it, but she requested it, but that it was denied. So she had to pay out of her own pocket for this evaluation. She understands that the teachers, they do a lot. They have 30 students in his classroom, but it's a lot for him. He cannot be in that type of with that amount of kids in the classroom. Um, these kids have a lot of potential. They just need the help from you. They need the budget. They need the support. She is saying that she's the advocate for her kid, and besides his condition, obviously he's got a lot of potential to learn, and she requests also to listen to us, to listen to everybody who came over and talked about it, teachers, parents, and advocates. And just to finish, they need the help, the support from the special education committee. So that's about it. Thank you.
Thank you. And thank you, Fiorello, for your testimony. All right. With that said, I think we're going to conclude for this evening. Thank you, everyone, for joining. Take care.